Visible? Just one moment. Okay. So hello students. So welcome to the sprint series of PW Med Ed. This is a special effort taken by our team for a quick revision of for the NEET PG exams. I welcome you all to this series of lectures that we would be taking. I'm Dr. Pradeep Pawar, Professor of Anatomy. So let us start. So it's a 4 hours class, 6:30 to 8:30, then a break of 15 minutes, and then we will continue 8:45 to 10:45. Okay. So welcome to all of you. And here we start with the first MCQ. So let us discuss the MCQs and simultaneously we'll discuss the theory part of it. So the things becomes clear while discussing the options, you would also come to know the theory part. Okay, we start with the first MCQ. These are the previous PYQs for you. Let us start. A 35 years old male complains of persistent toothache. The surgeon decided to extract the lower molar. He identifies the pterygomandibular raphe and inserts a needle close to it. The block is going to affect all the following nerves except. Yes, students. Any guesses? What is the answer for this? Any guesses? So I'll focus on the important things for you. PDF you'll be getting, everything you'll be getting, students. Just concentrate on the lecture now and keep on answering. Be interactive. Let us have an interactive session. Okay, everything you'll be getting. So what is the answer for this MCQ? The block is going to affect all the nerves except. Okay, let me explain. Let me explain you. So this pterygomandibular raphe, let me explain. What is this pterygomandibular raphe? This pterygomandibular raphe begins from, you can see this is the pterygomandibular raphe. It begins from the medial pterygoid plate. The medial pterygoid plate has got a hook. What is that known as? Pterygoid hamulus. And from the pterygoid hamulus begins a raphe. And this raphe is attached to the mandible, just behind the mylohyoid line. Right? So this pterygomandibular raphe begins from the pterygoid hamulus and it is attached just behind the mylohyoid line of the mandible. And this pterygomandibular raphe is very important, students, for the dentist, because they are going to feel this raphe and they are going to put the needle here to give anesthesia in the vicinity of inferior alveolar nerve, right? So which are the nerves related to the pterygomandibular raphe? See students, pterygomandibular raphe, दो nerves related होता है. There are two nerves related to this pterygomandibular raphe. ये है pterygomandibular raphe. There are two nerves related to it. One is the inferior alveolar nerve, and the second one is the lingual nerve, So lingual nerve and inferior alveolar nerve, these are the two nerves related to the pterygomandibular raphe, right? So look at the options now. So the block is going to affect all the following nerves except. So inferior alveolar nerve will be blocked. This is correct. Lingual nerve is also related to pterygomandibular raphe. This inferior alveolar nerve enters this foramen, students. What is this foramen here? That's the mandibular foramen. It enters into the mandibular foramen and gets out from here. What is the nerve now known as? Answer this. इसको क्या बोलोगे? What is this nerve which emerges from this foramen? ये foramen क्या होता है? That's the mental foramen, right? And the nerve is known as mental nerve. So अगर आप inferior alveolar nerve का block देते हो, the inferior alveolar nerve is blocked. In addition, which is the other nerve blocked? The mental nerve. Mental nerve भी block हो जाएगा. So mental will also be there. So all this following nerves will be blocked. Inferior alveolar, lingual, or mental. So the nerve which would not be blocked is buccal nerve. Answer is buccal for this, huh? Buccal. So which nerve is not going to be blocked? Buccal nerve. समझ में आ रहा है ये बच्चों? Are you understanding this? Now, so pterygomandibular raphe is related to two nerves. ये याद रखना. One is lingual nerve and the second one is inferior alveolar nerve. Inferior alveolar nerve. We'll discuss this. थोड़ा सा details मैं बोलता हूँ आपको. You'll understand this. But before I proceed, students. Yeah, just one moment. Understand this. This pterygomandibular raphe gives origin to two muscles. Students, this pterygomandibular raphe gives origin to two muscles. Can anyone tell me what is this muscle? ये कौन है? Students, what is this muscle? One moment. What is this muscle and what is this muscle? चलो, guess करिए. Can you guess this, students? Yes? What is this muscle? Pterygomandibular raphe gives origin to two muscles. See, what I'm telling you is very important from the point of view of MCQs. So try to understand each and everything. Just समझ लो what I'm telling you. Any guesses, students? Pterygomandibular raphe gives origin to two muscles. One, हिंदी में भी बोल रहा हूँ. I'm telling you in Hindi also. Don't worry. So this is the buccinator. ये है buccinator muscle. And what is this muscle? ये कौन सा muscle है पीछे? This is the superior constrictor. Superior constrictor. This is extremely important, students. The pterygomandibular raphe gives origin to two muscles. Lateral pterygoid नहीं है बच्चों. It's not lateral pterygoid. Remember, the pterygomandibular raphe gives origin to two muscles. The muscle in front is the buccinator. ये है buccinator muscle, and the muscle behind is the superior constrictor. The nerve supply of buccinator. Can anyone tell me the nerve supply of buccinator? That's the facial nerve. Facial nerve. And the nerve supply of superior constrictor, वो है pharyngeal plexus. Pharyngeal plexus. Clear है? So look here once again. Pterygomandibular raphe begins from the pterygoid hamulus. It is attached to the mandible behind the mylohyoid line. दो nerves है which are related to this raphe. एक है lingual nerve and the second one is inferior alveolar nerve. This pterygomandibular raphe gives origin to two muscles. The muscle in front is buccinator and the muscle behind is the superior constrictor. This all things are very important. So buccinator का nerve supply क्या होगा? What is the nerve supply of buccinator? Facial nerve. And the nerve supply of superior constrictor is going to be the pharyngeal plexus. Am I clear to all of you? Now, just I'll tell you something about the mandibular nerve. This is very important. Have a look at this. Mandibular nerve. One moment. Mandibular nerve. Now, quickly, students, tell me what are the parts of the mandibular nerve? ये mandibular nerve एक बार आ जाता है. Once you know this mandibular nerve, many of the MCQs will be clear to you. So just remember this mandibular nerve. This is the trunk of the mandibular nerve, trunk, and it has got two divisions. What are these two divisions? एक होगा anterior division and one is the posterior division of the mandibular nerve. ठीक है? So what are the branches from the trunk of the mandibular nerve? The branches from the trunk are nerve to medial pterygoid, nerve to medial pterygoid, right? And the other one is nervous spinosus. Nervous spinosus. ठीक है? So branches from the trunk. One is the nerve to medial pterygoid. And this nerve to medial pterygoid supplies two more muscles. It supplies the tensor palatii, and tensor tympani. Tensor palatii and tensor tympani. So I'm just telling you the mandibular nerve. एक बार mandibular nerve is clear, many of the MCQs you will be able to answer. So mandibular nerve has a trunk. It has got two divisions, branches from the trunk. One is the nerve to medial pterygoid, and the second one is the nervus spinosus. The nerve to medial pterygoid supplies the medial pterygoid. It also supplies two more muscles. One is the tensor palatii and the tensor tympani. Students, mandibular nerve is a nerve which pharyngeal arch. ये कौन से pharyngeal arch का nerve है? It's a nerve first pharyngeal arch, है ना? It's a nerve first pharyngeal arch. अब all the muscles which are derived from the first pharyngeal arch would be supplied by whom? Mandibular nerve. जितने भी muscles है which are derived from the first arch will be supplied by the mandibular nerve. So indirectly you are understanding the mandibular nerve, the muscle supplied by the mandibular nerve. Clear? हाँ, I'm telling you in Hindi also, Hindi English. Fine. Now, anterior division gives three muscular branches and one sensory branch. तीन muscular branches and one sensory branch. अब इसे कैसे याद रखोगे? What are the muscular branches from the mandibular nerve, anterior division? One is the masseteric nerve. Masseteric nerve. Second is deep temporal nerve. Deep temporal nerve. One is masseteric nerve, second is deep temporal nerve, and the third is nerve to lateral pterygoid. Nerve to lateral pterygoid. So just remember, these are the three muscles of mastication. Students, these are the three muscles of mastication. So just remember, masseter, the nerve is masseteric nerve. Lateral pterygoid, that's a nerve to lateral pterygoid. And temporalis, that's the deep temporal nerve. Clear? Fine. One sensory branch. What is the sensory branch? That's the buccal nerve. Buccal nerve. Right? And this buccal nerve is going to supply, it is a sensory branch, it's a cutaneous branch. So what is this buccal nerve going to supply? It supplies the skin over the buccinator. Students, skin over the buccinator is supplied by whom? Buccal branch of mandibular nerve. Remember, buccinator is supplied by whom? Facial nerve. है ना? Buccinator is supplied by facial nerve. And the skin over the buccinator, ये कौन supply करेगा? The buccal branch of mandibular nerve. Okay, fine students, clear. Now tell me the posterior division. The posterior division के branches बोलो. Posterior division gives one lingual nerve, lingual. Second, auriculotemporal nerve. And the third nerve, any guesses? The third nerve is inferior alveolar. This is the easiest way to understand the mandibular nerve. So, एक है lingual nerve, the second one is the auriculotemporal nerve, and the third one is the inferior alveolar nerve. Now, this inferior alveolar nerve gives a branch, that's the nerve to mylohyoid. Nerve to mylohyoid, ठीक है? Yes, I'm telling you. So the nerve to mylohyoid, अब ये क्या supply करेगा? What is this nerve to mylohyoid going to supply? It supplies two muscles, mylohyoid and anterior belly of digastric. ये सब notes मिलेंगे आपको. You'll get this notes, you'll get this PDF, students. This will be there on the Telegram group of PW Med Ed. So everything will be given to you. Just concentrate on the lecture and try to understand, try to be interactive. ठीक है? Answer करिए. Clear? So that's a complete mandibular nerve. Students, this is the complete mandibular nerve. एक बार repeat करता हूँ. Yes. So one is the trunk, anterior and posterior division. Hello, Tanmay. So from the trunk, you get nerve to the medial pterygoid, the nerve to tensor palatii and tensor tympani, and the nervus spinosus. Anterior division gives three muscular and one cutaneous branch. Muscular branches, masseteric nerve, deep temporal nerve, and the nerve to lateral pterygoid. Sensory branch is the buccal nerve. Posterior division gives lingual nerve, the auriculotemporal nerve, and the inferior alveolar nerve, which further gives nerve to mylohyoid, which supplies the mylohyoid and the anterior belly of digastric. ठीक है बच्चों, is this clear to all of you? So mandibular nerve is a nerve which pharyngeal arch first, है ना? First pharyngeal arch की nerve है mandibular nerve. So all the muscles which are derived from the first arch would be supplied by the mandibular nerve. So indirectly, what are we understanding? We are understanding the muscles derived from the first pharyngeal arch. है ना? These are the muscles derived from the first pharyngeal arch. Okay. Yes, I'm telling you the attachments of the pterygomandibular raphe. Look at this. This is the pterygomandibular raphe. The muscle in front, ये कौन है? Buccinator, and the muscle behind is the superior constrictor. Superior constrictor. Fine. Okay. Right. Can anyone tell me what is this? What is this nerve? This is a very important slide, students. ये बहुत important slide है. Posterior belly of digastric is supplied by facial nerve. Facial. Posterior belly is facial nerve. Anterior belly is mandibular nerve. Remember that. ठीक है, ये कौन है? And what is this nerve? चलो students, can you identify this? Yes. What are these two nerves? ये बहुत इंपॉर्टेंट स्लाइड है. दिस इज अ वेरी इंपॉर्टेंट स्लाइड. सो दिस इज अ स्लाइड ऑफ infratemporal fossa. Students, this is a slide of infratemporal fossa. What is this nerve and what is this nerve? So this nerve in front is the lingual nerve, and the nerve behind is the inferior alveolar nerve. The nerve behind is inferior alveolar nerve. जो nerve आगे है, that's lingual nerve. And what is this nerve? This is the nerve to mylohyoid. Nerve to mylohyoid. Fine. Okay, what is this muscle? Can anyone tell me? ये muscle का नाम क्या है? What is the name of this muscle? That's the medial pterygoid. This muscle is the medial pterygoid. Okay, I hope this MCQ is clear to all of you. अब clear है? Should I proceed? Yes, inferior alveolar nerve gets out through the mental foramen. उसे हम बोलते हैं mental nerve. That's a mental nerve. The nerve in front is lingual, the nerve behind is inferior alveolar. I hope this is clear. MCQ is clear, students. I'll proceed. Very good, very good. Very good to all of you. Very good. Chalo, we'll go to the next MCQ. Have a look at this. A first prof student was preparing for his final exams. He was revising the topics of pharyngeal arches. One of the following muscle is derived from the first pharyngeal arch. Come on students, can you answer this? Yes, बच्चों बोलिए, आंसर करिए ये. Another very important MCQ है, ये बहुत important MCQ है. Pharyngeal arches, the contents, the various contents of the pharyngeal arches. Everything will be clear, बच्चों. Just concentrate on the lecture and be interactive. Everything will be clear. I'll try to give you as much as possible. Okay. Mylohyoid. Very nice students. Very nice. The answer is mylohyoid. So the muscle derived from the first pharyngeal arch is mylohyoid. Ab jaldi boliye, which are the muscles derived from the first arch? The four muscles of mastication. The four muscles of mastication: masseter, temporalis, the medial, and the lateral pterygoid. Two muscles. One is the tensor palati, the tensor tympani. Two more muscles, the mylohyoid and the anterior belly of digastric. Mylohyoid and anterior belly of digastric. So the muscles which are जो muscles first arch से derive होते हैं, which are these muscles? One, the four muscles of mastication: temporalis, masseter, the medial and the lateral pterygoid, anterior belly of digastric, mylohyoid, the tensor palati and the tensor tympani. ये clear है that these are the muscles derived from the first arch. Very good, very good, very good. Which is the nerve of the first arch? बोलिए, चलो आंसर करिए. Answer is A. Yes. Which is the nerve of the first arch? Mandibular nerve. Mandibular nerve is the nerve of the first arch. Can anyone tell me posterior belly of digastric is derived from which arch? Second arch. Posterior belly of digastric is derived from second arch. Buccinator is derived from second arch. Which are the muscles derived from the second arch? One are the muscles of facial expressions. ये जितने भी muscles है facial expressions के, these are derived from the second arch. A muscle in the ear, what's that? Stapedius. The stapedius. The posterior belly of digastric and the stylohyoid. Posterior belly of digastric and stylohyoid. These are the muscles derived from the second pharyngeal arch. Once again, the muscles of facial expressions. जितने भी ये muscles है facial expressions के, all the muscles of facial expressions. What else? One muscle in the ear. What's that? Stapedius. The muscle is stapedius. The posterior belly of digastric and the stylohyoid. These are the muscles of second pharyngeal arch. Which is the nerve of the second arch? Students, the nerve of the second arch is facial nerve. Correct? Fine. Which is the muscle in the third arch? Can anyone answer this? A muscle in the third arch. बोलिए. Muscle in the third arch and the nerve of the third arch. Extremely important, a student. Extremely important. हाँ मैं हिंदी में बात कर रहा हूँ. Yes, I'm talking students. I'm talking. Which is जो third arch की nerve है. What is the name of that nerve? Nerve of the third arch. I'll talk in Hindi as well as English. Okay. The nerve of the third arch is which is that nerve, students? Glossopharyngeal. Very good, very good. That's a glossopharyngeal nerve. Glossopharyngeal nerve, and the muscle is stylopharyngeus. Very nice. Stylopharyngeus. Very good. And the nerve of the fourth arch. Fourth arch. Yes, anyone? The nerve of the fourth arch and the nerve of the sixth arch. Yes, very good, very good. Fourth arch का nerve कौन है? That's the superior laryngeal nerve. Superior laryngeal nerve. Nerve of the fourth arch is superior laryngeal. Yes, and the nerve of the sixth arch is recurrent laryngeal nerve. Nerve of the fourth arch is superior laryngeal and the nerve of the sixth arch is recurrent laryngeal nerve. So what muscles are derived from here? The cricothyroid. Cricothyroid. What is derived from the fourth arch? Cricothyroid. Superior laryngeal and recurrent laryngeal, ये किसके branches हैं? ये दोनों किसके branches हैं? Vagus के. The superior laryngeal and recurrent laryngeal, both are branches of vagus. And recurrent laryngeal nerve is the nerve sixth arch. Which are the muscles derived here? The muscles of the pharynx and larynx. Muscles of the pharynx and larynx. Okay, clear? Muscles of pharynx and larynx. So levator palati is derived from fourth arch. Levator palati is derived from fourth arch. The muscle of the palate is derived from the fourth arch. Is this clear, students? Is this MCQ clear to all of you? Students, is this MCQ clear? Head and neck is very important. Head and neck के बहुत MCQs आते हैं. So I have given this head and neck. Okay, so answer here is mylohyoid. Okay, fine. Coming to the next MCQ, students, answer this. Chalo, a very important MCQ. I'll start. Concentrate. A 50 years old patient complains of tears rolling out of his eyes while having food. He also complains of inability to tolerate loud sounds. Inability to tolerate loud sounds. Tell me, students, which is the muscle which helps in dampening of the sound? वो कौन सा muscle है जो sound waves को कम करता है? Which is that muscle which reduces the sound waves when the frequency of sound waves when it enters inside the ear? Students, answer this. Which is that muscle which reduces the frequency of sound waves? The decibels it reduces. That's the stapedius, है ना? The muscle is stapedius. And who supplies the stapedius? That's the nerve to stapedius. That's facial nerve. Facial nerve. So facial nerve supplies the stapedius. He also complains of inability to tolerate loud sounds. So who's paralyzed? Stapedius. So who's involved? Facial nerve. Facial nerve is involved. On examination, there is loss of taste sensations on the anterior 2/3 of the tongue. Students, can you tell me who supplies taste sensations to the anterior 2/3 of the tongue? Which is the nerve? Which is the nerve which supplies taste sensations to the anterior 2/3? That's the chorda tympani. Chorda tympani. Taste sensation is chorda tympani and general sensations is lingual nerve. General sensations is supplied by lingual nerve and taste sensations is supplied by chorda tympani. So chorda tympani is damaged. The pain and temperature sensations are intact. मतलब lingual nerve intact है ना? Lingual nerve is intact. The person is not able to whistle. कोई बोल सकता है whistling muscle कौन है? Which is the muscle which helps in whistling? Students, answer. Which is the muscle which helps in whistling? Or this? Which is that muscle? Buccinator. Very good. The muscle which helps in whistling is the buccinator. The person is not able to whistle. That means buccinator is paralyzed. Lesion is located at which of the following sites? Yes, I'll just explain the facial nerve quickly. एक थोड़ा सा facial nerve explain करता हूँ. Tell me, facial nerve enters into which foramen of the skull? Students, can you answer? Facial nerve कौन से foramen में जाता है? Inside the skull, inside the skull. Which foramen does the facial nerve enter? Any guesses, students? This is very important. ये बहुत important है. Which is that foramen into which the facial nerve enters? I'm waiting. Answer. We'll discuss the facial nerve. एक बार facial nerve discuss करते हैं, then you will understand this. हाँ, ये समझ में आ जाएगा आपको. Stylomastoid नहीं बच्चा, stylomastoid is later. Stylomastoid is later. Facial nerve comes out through the stylomastoid foramen. हाँ, internal acoustic meatus. Very good. So facial nerve enters the internal acoustic meatus. हाँ, along with the eighth nerve and the labyrinthine artery. ये याद रखना, दिस इज वेरी इंपॉर्टेंट. फेशियल नर्व कौन से फोरामेन में जाती है? इंटरनल acoustic meatus के अंदर. along with the facial nerve, the vestibulocochlear nerve and the labyrinthine artery, they enter the internal acoustic meatus. Okay बच्चा, now अब facial nerve enters into the internal acoustic meatus. अब ये कहाँ जाएगा? Where does it go then? It enters into the internal ear. एक शॉर्ट में बोल रहा हूँ facial nerve, हाँ शॉर्ट में. It enters into the internal ear. अब from the internal ear, the facial nerve comes in the middle ear cavity. Facial nerve comes in the middle ear cavity. What is this wall of the middle ear? Medial wall of middle ear. Medial wall. ठीक है. ये है, I'll tell in Hindi also. ये है medial wall of middle ear. ये क्या elevation है? ये क्या elevation है? बोल सकते हैं? What is this elevation? ये elevation का नाम क्या है? The medial wall of middle ear पे एक elevation होता है, इसका नाम this is known as the promontory. ये है promontory, right? Now the facial nerve is in the internal ear. From the internal ear, the facial nerve now comes into the middle ear cavity, है ना? अब ये middle ear में आ जाता है. ये medial wall of middle ear है. The facial nerve goes over the promontory. It goes above the promontory, then goes, अब ये promontory के पीछे जाती है. It goes behind the promontory and gets out through this foramen. ये क्या foramen है बच्चों? What is this foramen? That's the stylomastoid foramen. Stylomastoid foramen. And जैसे ये stylomastoid foramen से बाहर आता है, the moment it emerges out through the stylomastoid foramen, it enters the parotid gland. अब ये gland क्या है? Parotid gland. And then it gives 5 branches. है ना? ये 5 branches देती है. Fine. So facial nerve enters the internal acoustic meatus. It is in the internal ear. ये internal ear में होती है. From the internal ear, अब ये middle ear में आती है. It now comes in the middle ear. It goes above the promontory, then goes behind the promontory and then gets out through the stylomastoid foramen. अब ये stylomastoid foramen से बाहर आ गई. It enters into the parotid gland and it gives 5 branches. अब ये 5 branches देगा to supply the muscles of facial expressions. Clear, students? Now, in the ear, the facial nerve gives 3 branches. 3 branches देती है. Can anyone tell me? One is this. This is the first nerve. That's the second nerve and that's the third nerve. ये कौन है? What is this? Number 1. Number 1 is greater petrosal nerve, है ना? ये है greater petrosal nerve. Yes. Okay, PK बोल रहा हूँ. That's a greater petrosal nerve. What is this? ये है nerve 2 stapedius. Nerve 2 stapedius. And ये कौन है? ये है chorda tympani. Chorda tympani. Chorda tympani. ठीक है? So in the ear, in the middle ear, the facial nerve 3 branches देती है. It gives 3 branches. One, एक है greater petrosal nerve. Second is the nerve to stapedius, and third is the chorda tympani. Now students, ये chorda tympani क्या supply करती है? Can you tell me this chorda tympani, what does it supply? Yes, it supplies. What does the chorda tympani nerve supply? Anyone? It supplies taste sensations to, see, if you understand this ना, ये समझ लो. अगर ये समझ में आता ना, the entire lesions of facial nerve would be clear to you. How to locate the site of lesion, that will be very clear. It supplies taste sensations to anterior 2/3. Okay, and it supplies the submandibular and the sublingual glands. Submandibular and the sublingual glands, है ना? This is what the this is what the chorda tympani supply. So students, chorda tympani क्या supply करेगा? It supplies taste sensations to the anterior 2/3 and it supplies the submandibular and the sublingual salivary glands. Secretomotor है. It is secretomotor to the submandibular and sublingual glands. हाँ, ये है. What is the nerve to stapedius supply? This is supplying the stapedius. Okay. This supplies the stapedius. And what is the greater petrosal nerve supply? The greater petrosal nerve supplies all the glands. Which are all the glands? It supplies the lacrimal, nasal, palatine, pharyngeal. Lacrimal, nasal, palatine and pharyngeal glands. Students, बस ये समझ लो, understand this. So greater petrosal nerve supplies all the glands except parotid. Okay. In other words, facial nerve supplies all the glands except parotid. Parotid gland को कौन supply करता है? Who supplies the parotid gland? Any guesses, students? Any guesses? Parotid gland को कौन supply करता है? Any guesses? Answer this. Who supplies the parotid gland? बोलो बच्चों, बोलो. Yes. Who supplies the parotid gland? That's the glossopharyngeal nerve. Yes, very good, Piyush. Very good. That's the glossopharyngeal nerve. Glossopharyngeal nerve supplies the parotid gland. Rest all the glands in the head and neck are supplied by whom? Facial nerve. Facial nerve. ठीक है? उसमें the greater petrosal nerve. Greater petrosal बच्चा, हाँ. Greater petrosal nerve supplies which glands? It supplies the lacrimal gland, nasal glands, palatine, pharyngeal glands. So students, if the greater petrosal nerve is damaged, there'll be a loss of secretions from this glands. है ना? There will be a loss of secretions from this glands. What is the nerve to stapedius supply? It supplies the stapedius. If this stapedius is paralyzed, what will happen? The person will complain of hyperacusis, very loud noises. And if the chorda tympani nerve is damaged, students, if the chorda tympani nerve is damaged, there will be a loss of taste sensations on the anterior 2/3 of the tongue. Plus, there will be a loss of secretions from the submandibular and the sublingual glands. ठीक है? Okay, fine. And suppose, बच्चों, if the facial nerve is injured here at the stylomastoid foramen. Students, if the facial nerve is injured at the stylomastoid foramen, what will the person complain of? The person will complain of Bell's palsy. ठीक है ना? Bell's palsy. So now you tell me, if the lesion is here, number 1, just at the level of stylomastoid foramen or below the stylomastoid foramen, what will the person complain of? Bell's palsy. ठीक है? अगर lesion यहाँ पे है, I'm writing this as number 2. If the lesion is just before the chorda tympani, तो क्या होगा? What will the person complain of? Person will complain of what? अगर injury is at second level पे injury है, तो what will the person have? Person will have Bell's palsy, plus the person will complain of loss of taste sensations in the anterior 2/3, plus loss of secretions from the submandibular and the sublingual glands. समझ में आ रही है? Okay. हाँ, शिवम, yes. अगर इंजरी यहाँ पे, I'm writing this as number 3. अगर इंजरी यहाँ पे, so the person will also complain of hyperacusis. तो hyperacusis भी होगा. ठीक है? Okay, fine. And अगर इंजरी यहाँ पे, this is number 4. अगर इंजरी level 4 पे, मतलब just before the genu के पहले, if the injury is just before the genu, तो क्या होगा? The person will complain of all this. ये जितने भी what we have written, the person will complain of all this. समझ में आ रहा है ये? Yes, विशाल, समझ में आ रहा है? So if you know this, अगर ये आपको पता है, you will be able to define the site of lesion. The site of lesion can be defined. Am I clear with the slide? ये slide clear है सबको? अगर lesion level 1 पे है, तो देयर विल बी बेल्स पैल्सी। अगर लीजन लेवल 2 पे है तो बेल्स पैल्सी के साथ देयर इज गोइंग टू बी अ लॉस ऑफ टेस्ट सेंसेशंस प्लस लॉस ऑफ सिक्रीशंस फ्रॉम द सबमैंडिबुलर एंड सबलिंगुअल ग्लैंड्स। अगर लीजन लेवल 3 पे है, in addition to all this there will be hyperacusis, and agar lesion 4th level pe hai, in addition to all this there will be a loss of secretions from the submandibular from the lacrimal, nasal, palatine and pharyngeal glands. Okay bachcho, clear? Is this clear? Okay, with this concept, ये बहुत इंपॉर्टेंट है बच्चों, अगर ये फ्लो चार्ट याद रखोगे you will be able to define the site of lesion. Perfect. वेरी गुड। अब देखिए, जस्ट सी दिस। चलो अब देखिए, अब आंसर करिए। I'll start, एक मिनट, I'll start, एक मिनट। A 50 years old patient complains of tears rolling out of his eyes while having food. He also complains of inability to tolerate loud sounds. मतलब कौन सा मसल पैरालाइज्ड है बच्चों? Which is the muscle involved? Stapedius. The stapedius is involved. ठीक है, stapedius is gone. Loss of taste sensations on the anterior 2/3. मतलब which is the nerve involved? Which is the nerve involved? Chorda tympani. The pain and temperature sensations are intact. मतलब lingual intact है. The person is not able to whistle. मतलब Bell's palsy है. Bell's palsy. And tears are rolling out of the eyes. Matlab that lacrimal gland is affected. Lacrimal gland. So where is the lesion now, bacha? Where is the lesion? The lesion is the facial nerve proximal to the geniculate ganglion. Very good, very good, very good, very nice. ठीक है, समझ में आ रही है? थोड़ा सा हिंदी एंड थोड़ा सा इंग्लिश आई टेल, सो एवरीवन विल बी बेनिफिटेड बच्चा। हम ठीक है, सो विथ हिंदी आई टॉक इंग्लिश ऑल्सो, सो इट विल बी बैलेंस्ड। हाँ ठीक है विशाल, फाइन। चलो, आंसर इज ए फॉर दिस। Chorda tympani in the infra-temporal fossa. बच्चों, just see the second option. If the chorda tympani nerve is injured in the infra-temporal fossa, what will the person complain of? What will the person complain of? अगर specific lesion है, specific lesion है chorda tympani का, chorda tympani का lesion है, तो what will the person complain of? Loss of taste sensations in the anterior 2/3. उसके साथ क्या होगा? The person will complain of loss of secretions from the submandibular and the sublingual glands. अगर फेशियल नर्व स्टाइलोमास्टोइड फोरामेन पे इंजर्ड होती है या फिर फेशियल नर्व पैरोटिड ग्लैंड में इंजरी होती है, इफ द फेशियल नर्व इज इंजर्ड एट द स्टाइलोमास्टोइड फोरामेन और द पैरोटिड ग्लैंड, व्हाट विल द पर्सन कंप्लेन ऑफ? बेल्स पैल्सी. बेल्स पैल्सी. परफेक्ट. इज दिस क्लियर बच्चों? समझ में आ रहा है? So answer is A for this. This is the easiest way to understand the facial nerve. Perfect. Very good, very good, very good. You understood it very well. हाँ, एक और चीज मैं बोलूंगा. I'll just tell you one more thing. Can you tell me the nucleus of facial nerve? Nucleus बोल सकते हो आप? Nucleus of facial nerve. Students? Very good, very good. Just tell me the nucleus of facial nerve. Okay. So, what is the facial nerve supply? One moment. I'll just tell you the nucleus of facial nerve. Very good, very good, very good. So facial nerve supplies the muscles of second pharyngeal arch. Just understand this, students. ये थोड़ा सा difficult है. अगर ये concept clear होता है ना, every MCQ of head and neck you will be able to answer. Facial nerve supplies the muscles of second pharyngeal arch. Second pharyngeal arch. To supply the muscles of second pharyngeal arch, वो कौन सा component होता है? सेकेंड pharyngeal arch के मसल्स को सप्लाई करने के लिए व्हाट इज द कंपोनेंट? द नेम ऑफ द कंपोनेंट इज, यस, एनी गेसेस? नेम ऑफ द कंपोनेंट इज स्पेशल विसरल efferent. Special visceral efferent. The facial nerve supplies the muscles of second pharyngeal arch. To supply the muscles of second pharyngeal arch, what is the component? Functional component क्या होता है? Special visceral efferent. And what is the name of the nucleus of facial nerve which is going to supply the muscles of second pharyngeal arch? वो न्यूक्लियस का नाम क्या है? फेशियल नर्व का न्यूक्लियस which supplies the muscles of the second pharyngeal arch, that is the motor nucleus of facial nerve. Motor nucleus of facial nerve. Second, what else does the facial nerve supply? The facial nerve supplies all the glands, है ना, ये सारे glands को supply करता है, except the parotid. Facial nerve supplies all the glands except parotid. अब to supply the glands, what is the component? General visceral efferent. General visceral efferent. And वो nucleus का नाम क्या है? What is the name of the nucleus of facial nerve which supplies the muscles, which supplies the glands? Superior salivatory nucleus and lacrimatory nucleus. Superior salivatory nucleus and lacrimatory nucleus. समझ में आ रही है? So what is the name of the nucleus of the facial nerve जो glands को supply करेगा? उसका नाम है superior salivatory and lacrimatory nucleus. वो component का नाम क्या है? General visceral efferent component. जो फेशियल नर्व फेशियल मसल्स को सप्लाई करेगा वो कंपोनेंट है स्पेशल विसरल एफरेंट एंड द नेम ऑफ द न्यूक्लियस इज मोटर न्यूक्लियस ऑफ फेशियल नर्व. द फेशियल नर्व सप्लाइज द टंग, एंटीरियर 2/3 ऑफ द टंग. वो कंपोनेंट का नाम क्या होता है? व्हाट इज द नेम ऑफ द कंपोनेंट? द नेम ऑफ द कंपोनेंट इज अ स्पेशल विसरल afferent and the nucleus is the nucleus of tractus solitarius. Nucleus of tractus solitarius. Are you clear? Students, समझ में आ रहे हैं? So that's the nucleus of tractus solitarius. Okay? Fine. Okay, is this clear to all of you? The nucleus? One moment. The nucleus of facial nerve is clear? Should I proceed? I'll proceed to the next slide. Okay, I'm not able to see the chat. One moment, I'm not able to see the chat. Fine, students. So we'll go to the next MCQ. चलो अब दूसरा MCQ देखते हैं. Identify the marked structure. Identify the marked structure. Any guesses? Just any guesses, students? Identify the marked structure. One moment. Okay, sorry for that. I got it. चलो, identify the mark structure. Mark structure ये muscle है, ये muscle है, muscle. चलो बोलिए बच्चों, what is this muscle? Sorry, we'll start. What is this muscle? Any guesses, students? Any guesses? What is this muscle? ये कौन सा region है? What is this region? This region is the infra-temporal fossa. Okay, this muscle is the infra-temporal fossa. इंफ्राटेम्पोरल फोसा ये मतलब व्हाट इज दिस? दैट्स अ मैंडिबल. ये रेमस होता है, दैट्स द बॉडी ऑफ द मैंडिबल. ठीक है, ये रेमस है, दैट्स द रेमस, ये बॉडी ऑफ द मैंडिबल है. यू रिमूव द रेमस, आप रेमस को निकाल दो, एंड व्हाट इज दिस एरिया नाउ? दैट्स द इंफ्राटेम्पोरल फोसा. ये है इंफ्राटेम्पोरल फोसा. दिस इज द इंफ्राटेम्पोरल फोसा. अब ये मसल कौन सा है? व्हाट इज दिस मसल? एनी गेसेस? वेर आर वी? Yes. Where are we? We are in the infratemporal fossa. ये इंफ्राटेम्पोरल फोसा होता कहाँ है? यू रिमूव द रेमस ऑफ द मैंडिबल. जैसे आप रेमस को निकाल देते हो, दैट्स द इंफ्राटेम्पोरल फोसा, एंड दिस इज द मीडियल टेरिगॉइड मसल. मीडियल टेरिगॉइड. वैसे मैंडिबल पे, मैंडिबल के बाहर की तरफ व्हाट इज दिस मसल आउटसाइड हियर ऑन द एंगल, बाहर की तरफ, दैट्स द मैसेटर. बाहर की तरफ मैसेटर है, अंदर की तरफ that's a medial pterygoid. Okay, this muscle is the medial pterygoid muscle. Okay, students, identify this structure which I've pointed for you. Any guesses? Yes, what is this structure? This is a very important slide. Remember, students, this is a very important slide. You remembered me. Where are we? Very good. So ये कौन सी nerve है? What is this nerve and what is this nerve? I just told you, students, मैंने अभी आपको बोला, infratemporal fossa में दो nerves होते हैं. There are two nerves which are present in the infratemporal fossa. जो nerve आगे होती है, the nerve in front is the lingual nerve. ये lingual nerve होगा. And जो nerve पीछे होगा, what is this nerve? That's the inferior alveolar nerve. Inferior alveolar, ठीक है? So जो nerve आगे होती है, that's the lingual nerve, and जो nerve पीछे की तरफ होता है, that's the inferior alveolar nerve. Am I clear? Auriculotemporal नहीं है ये बच्चा. Auriculotemporal is a different nerve. I'll show you that. मैं दिखाता हूँ. I'll show you. Clear? Lingual and inferior alveolar nerve. Very good. What is this artery? ये क्या artery है? Anyone? What is this artery here? You can see this, no? What is this artery? Yes, very good. Shruti, आगे lingual होता है, पीछे inferior alveolar होता है. Very good. What is this artery? This artery is the external carotid artery. External carotid. बाहर है ना, mandible के पीछे है. That's the external carotid artery. What is this branch? That's the, ये है superficial temporal artery. ये है superficial temporal. And what is this artery? That's the maxillary artery. Maxillary artery. ये maxillary artery है which is cut here. ये ऐसे होगा maxillary artery. ठीक है? So what are the branches of external carotid? External carotid के दो branches होते हैं. The branch which goes up, that's the superficial temporal artery, and this is the maxillary artery. Maxillary. Students, can you tell me, this maxillary artery is divided into three parts by which muscle? Students, maxillary artery के तीन parts होते हैं. It is divided into three parts by which muscle? कोई बोल सकता है? Maxillary artery के तीन parts होते हैं. It is divided by which muscle? Any guesses? Come on, students. Any guesses? Maxillary artery is divided into three parts by three muscles. By a muscle. What muscle is that? That muscle is the lateral pterygoid. ये muscle का नाम है lateral pterygoid. Okay, so maxillary artery is divided into three parts by the lateral pterygoid muscle. Lateral pterygoid. Medial pterygoid nahi, lateral pterygoid. Now, what are the branches of maxillary artery? Can anyone tell me branches of maxillary artery? This is very important. First part ke branches. You tell me, the axillary artery is divided into three parts. By whom? Axillary artery. Students, axillary artery is divided into three parts by which muscle? Any guesses? चलो बोलो जल्दी. Axillary artery is divided into three parts by pectoralis minor. Pectoralis minor. वो तीन parts है ना axillary artery के. So axillary artery is divided into three parts by pectoralis minor. First part का एक branch है, second part के दो branches है, third part के तीन branches है. First part of axillary artery gives superior thoracic, second part gives lateral thoracic and thoracoacromial, and the third part gives anterior circumflex humeral, posterior circumflex humeral and subscapular artery. ठीक है? So these are the branches of axillary artery which is divided into three parts. ये axillary artery को तीन parts में कौन divide करता है? Pectoralis minor. Subclavian artery is divided into three parts by which muscle? Students, Any guesses? Subclavian artery. You'll get the PDF. Don't worry. PDF मिलेगा आपको. PDF वगैरह सब मिल जाएगा बच्चों. Subclavian artery is divided into three parts. By which muscle? Any guesses? Any guesses? So axillary artery is by pectoralis minor. Subclavian artery is divided into three parts by scalenus anterior. Scalenus anterior muscle. Scalenus anterior. Okay. And maxillary artery is divided into three parts by lateral pterygoid. Lateral pterygoid. So what are the branches from the first part? The first part of maxillary artery gives, you have to know this, ये आना चाहिए आपको, deep auricular, anterior tympanic, middle meningeal, accessory meningeal, and inferior alveolar. Deep auricular, anterior tympanic, middle meningeal, accessory meningeal and inferior alveolar. ठीक है, तो ये है ब्रांचेस फर्स्ट पार्ट के. सेकेंड पार्ट के ब्रांचेस ये याद रखिए बच्चों, दिस इज इंपॉर्टेंट. सेकेंड पार्ट के ब्रांचेस, सेकेंड पार्ट क्या सप्लाई करती है? सेकेंड पार्ट सप्लाइज द मसल्स ऑफ मैस्टिकेशन. सो मैसेट्रिक आर्टरी, deep temporal artery, artery to the pterygoids, and fourth is the buccal artery. Clear? So masseteric artery, the deep temporal artery, the artery to the pterygoids and the buccal artery. So these are the four branches from the second part of maxillary artery. Maxillary artery gives 15 branches. Students, 15 branches है maxillary artery के. First part के 5 branches है, second part के 4 branches and the third part gives 6 branches. I'll tell you. अब आइए third part की तरफ. Third part. Very good, very good. Third part के branches देखिए. 1. Posterior superior alveolar. Posterior superior alveolar. Infra-orbital artery. Greater palatine. Pharyngeal artery. Artery of pterygoid canal. MCQs आते इस पे, MCQs आते हैं. And the last one is spinopalatine. बस एक निमोनिक बना लीजिए और इसे याद रखिए. हाँ, एक निमोनिक बना के याद रखिए इसको. ठीक है. So 15 branches of maxillary artery and this maxillary artery is divided into 3 parts by lateral pterygoid muscle. Lateral pterygoid. Clear to all of you? 15 branches clear है बच्चों? Are these branches clear to all of you? The branches of maxillary artery. The infra-temporal fossa clear है. 2 nerves in the infra-temporal fossa clear है. जो आगे होती है, the nerve in front is lingual and जो पीछे होती है, the nerve behind is inferior alveolar nerve. बस ये याद रखना. Big pass. Gokul, very good. Yes, very good, Gokul. Big pass is the mnemonic for the third part. Very good. So clear to all of you? Yes, slide clear है? Okay, that's it, children, that's it. Fine. We go to the next MCQ, students. Answer this. Number 5. Here we start. A 50 years old PIGPAS, PIGPAS, वो फर्स्ट लेटर है ना, PIGPAS, थर्ड पार्ट का ब्रांचेस, थर्ड पार्ट. सो है ना, एक एमसीक्यू आया था बच्चों, एक एमसीक्यू आया था, pharyngeal artery is a branch of, pharyngeal artery is a branch of, and students had written external carotid. बच्चों ने लिखा external carotid. Students, pharyngeal artery is a branch of maxillary artery. It is not a branch of external carotid. Which is the branch of external carotid जिसका नाम है pharyngeal? The name with pharyngeal? Any guesses, students? Any guesses? Which is the branch of external carotid with the name pharyngeal? हाँ. Answer that. Which is the branch of external carotid with the name pharyngeal? External carotid के कौन से branches होते हैं? I'm asking you the branches of external carotid. Branches of external carotid. Ascending pharyngeal. Yes, ascending pharyngeal. So what are the branches of external carotid? The branches of external carotid artery. Quickly tell me the branches of external carotid artery. Anterior branches. बोल सकते हो बच्चों? Anterior branches. Come on, quickly you tell me. Anterior branches of external carotid. One is superior thyroid. Superior thyroid. Lingual and facial. Branches of external carotid है ये. Anterior branches, superior thyroid, lingual, facial. Posterior branches, ये भी मैं बोल रहा हूं आपको, हाँ, ये भी मैं बोल रहा हूं. Posterior branches are posterior auricular and occipital. Posterior auricular and occipital. Medial branch, ascending pharyngeal, and terminal branches. Terminal branches कौन से हैं? Terminal branches, superficial temporal and maxillary. Superficial temporal and maxillary. Perfect. Okay. So these terminal branches are given in which gland? Students, the terminal branches are given in parotid gland. Parotid gland के अंदर होते हैं. Okay, perfect. External carotid is another very important MCQ. Students, remember that. External carotid, another very important MCQ. Okay, fine. Very good. Chalo, so we've discussed this also. We'll start with this. Number 5. A 50 years old male complained of swelling in the submandibular region. Fine. On examination and investigation, tumor of the submandibular gland was diagnosed. During surgical excision of the gland, the Wharton's duct was injured. What is Wharton's duct? Submandibular duct. Wharton's duct is submandibular duct. What is Stenson's duct? Stenson's duct. Students, bolo, Stenson's duct. Answer is B. Barabar. Answer is B. Stenson's duct is which duct? Parotid duct. है ना? Stenson's duct is parotid duct. And can anyone tell me structures pierce? What is a parotid duct pierce? Stenson's duct. Stenson's duct is parotid duct. And what is a parotid duct pierce? It pierces some muscle. Anyone? It pierces the buccinator. Parotid duct is going to pierce the buccinator. Stenson's duct. It pierces the buccinator muscle. Okay. And where does the parotid duct open? It pierces the buccinator and opens in the vestibule of the mouth. है ना? It opens in the vestibule of the mouth opposite to the crown of upper second molar tooth. ये parotid duct कहाँ पे खुलता है? ये पहले buccinator को pierce करेगा. It pierces the buccinator. अब ये वेस्टिब्यूल में खुलता है. इट ओपन्स इन द वेस्टिब्यूल ऑफ द माउथ ऑपोजिट टू द क्राउन ऑफ अपर सेकेंड मोलार टूथ. अपर सेकेंड मोलार टूथ. perfect. चलो. So during surgical excision of the gland, Wharton's duct was injured. Wharton's duct is submandibular duct. Which of the following nerve is most likely to be damaged during this process? So answer is, yes, you can listen to the lecture. Answer is lingual nerve. Lingual. Okay, lingual. I'll show you one slide. Yes, Shamil, you can sit for this lecture, no problem. Just have a look at this slide, students. What is this slide? This is a slide of the oral region. A very important slide, students. This is a very, very important slide. अब can anyone tell me ये muscle कौन है? ये muscle का नाम क्या है? What is this muscle? This muscle. चलो बच्चों बोलो. ये muscle का नाम क्या है? Any guesses? What is the name of this muscle? This muscle is known as the KEY, key muscle of the oral region. Key muscle. This muscle is known as the key muscle. Any guesses? Hyoglossus. Very good. Ayan. हाँ, very good. Uzma. That's hyoglossus. ये muscle का नाम है hyoglossus. This is very important. ये hyoglossus, and this hyoglossus is known as the key muscle, KEY, key muscle of the oral region. वैसे, anyone can tell me which is the key muscle of the gluteal region? Key muscle of the gluteal region? Any guesses? Yes, बच्चों बोलो. Key muscle of the gluteal region. Yes. Wait, answer. I'm waiting. Key muscle of the gluteal region is, it's a pear-shaped muscle. ऐसे pear-shaped muscle होता है. And the moment you get this muscle, you get everything. जितना भी है, you get everything in this region. ये muscle का नाम क्या है? Piriformis. So ये key muscle of the gluteal region क्या होता है? Piriformis. Very good. So key muscle of the oral region is hyoglossus. ये muscle का नाम है hyoglossus. Now, why is the hyoglossus known as key muscles? There are structures जो hyoglossus पे lie करते हैं. There are structures which are lying on the hyoglossus, and there are structures which are lying behind the hyoglossus or behind the hyoglossus. Okay. Now, which are the structures which lie on the hyoglossus muscle? What is this number one? Can anyone answer this? Number one. ये कौन है? What is this number one? Students, answer. I'm waiting for your answers, sir. ये number one कौन है? ये nerve है, nerve. What is this nerve? Number one. हाँ. Yes, someone. What is this nerve? बोलिए. ये है lingual nerve. Lingual nerve. ये है lingual nerve. Okay. What is this ganglion? ये ganglion का नाम क्या है? Yes, which is a ganglion hanging from the lingual nerve. ये ganglion का नाम क्या है? That's the submandibular ganglion. Submandibular ganglion. ठीक है? What is this structure which lies on the hyoglossus? This is a very important MCQ. Very important MCQ. Structures lying on the hyoglossus. ये है submandibular gland. Submandibular gland. ठीक है? What is this number 4? ये number 4 कौन है? That's a submandibular duct. Otic ganglion नहीं है. That's not otic ganglion. That's a submandibular ganglion. Submandibular ganglion. ठीक है? यह है submandibular ganglion. What is this duct? ये duct का नाम है Wharton's duct or the submandibular duct. And what is this number 5? Number 5. What is this nerve? ये कौन है? What is this number 5 nerve? This is the hypoglossal nerve. Hypoglossal nerve. So structures lying on the hyoglossus, a very important MCQ. I'll just write this for you. Structures lying on the hyoglossus. A very important MCQ. Huh? 1. Lingual nerve. Second is the submandibular ganglion. Submandibular ganglion. Third is the submandibular gland. Fourth is the submandibular duct. And the fifth is hypoglossal nerve. Hypoglossal nerve. This is extremely important, students. You should know this. So structures lying on the hyoglossus: lingual nerve, the submandibular ganglion, the submandibular gland, the submandibular duct, and the hypoglossal nerve. And the structures lying behind the hyoglossus, is the glossopharyngeal nerve and lingual artery. Glossopharyngeal nerve and the lingual artery. This you should know. बहुत सारे structures है in relation to the hyoglossus. Hyoglossus is therefore known as key muscle of the oral region. Key muscle of the oral region is hyoglossus. Clear है बच्चों? Is this clear? Just have a look at this slide once again. So number 1 is the lingual nerve. Number 2 is the submandibular ganglion. Number 3 is the submandibular gland. Number 4 is the submandibular duct. Number 5 is the hypoglossal nerve. Number 6 is the glossopharyngeal nerve. And number 7 is the lingual artery. Okay? 6 is glossopharyngeal nerve and 7th is lingual artery. Perfect. Now see this. This lingual nerve turns around what? The lingual nerve turns around. It hooks around the submandibular duct. है ना? The lingual nerve is going to hook around the submandibular duct. So when we are removing, आप जब submandibular gland को निकाल रहे हो, when you are cutting the submandibular duct, which is the nerve which can get damaged? Lingual nerve damage हो सकती है. ठीक है? Is this clear, students? Perfect. Yes, Satyajit, very good. Yes, medicos. Perfect. Very good. Perfect. Clear. Any doubts? Anyone has? Yes, Faisal. Very good. Right. ये देख लो. अब inferior alveolar nerve आपको पता है बच्चा? Inferior alveolar nerve, you know, inferior alveolar nerve is a branch of mandibular nerve. ये मैंने आपको बोला है. Inferior alveolar nerve ये कौन से foramen में जाती है? Which foramen does it go? Mandibular foramen. And what are the branches of inferior alveolar nerve? यहाँ से बाहर आती है. It emerges out from here. That is known as the mental nerve. And the inferior alveolar nerve gives what? The nerve to mylohyoid. ये मैंने बोल दिया आपको. Marginal mandibular branch of facial. This is the branch of facial nerve which runs along the margins of the mandible. जो mandible के margins पे जाती है, that is the marginal mandibular branch of facial nerve. Clear? I hope this is clear. So answer for this is lingual nerve. Okay, perfect. Very good, children. Very good. So identify the pointed structure. Chalo, answer this. Number 6. Identify the pointed structure. Any guesses? I have not put the options. Options मैंने नहीं दिए यहाँ पे. ये है ये. What is this area? What is that area? This was a slide. ये पूछा था. This was a slide which was asked in the previous year MCQs. ये कहाँ पे? What are you seeing? क्या है? Pyriform fossa. Yes, very good. Yes, Dr. Drimmer. Smuggler's pouch. Manu, very good. इसे हम बोलते हैं smuggler's pouch. इसे हम बोलते हैं pyriform fossa. Yes, ये tongue है. देखिए, ये tongue है. This is the tongue. है ना? What is this structure? ये structure का नाम क्या है? बोल सकते हो? What is this which I've pointed? ये क्या point किया मैंने? Very good. ये है epiglottis. यह है epiglottis, है ना? That's the epiglottis. Can anyone tell me, students, epiglottis is derived from which pharyngeal arch? Any guesses? Epiglottis is derived from which pharyngeal arch? Students, answer this. Epiglottis is derived from which pharyngeal arch? बोल सकते हो? Anyone? Come on. Epiglottis is derived from which pharyngeal arch? एक अब quickly बोल रहा हूं मैं. I'll just quickly tell you. What are these? These are the ectodermal clefts, है ना? ये ectodermal clefts होते हैं. And what are these? Endodermal pouches. ये होते हैं endodermal pouches. ये है endodermal pouches and ये है ectodermal cleft. बाहर से ectodermal cleft. यह है सेक्शन ऑफ द नेक. ये नेक का सेक्शन लिया हमने. सो ये बाहर से, व्हाट इज दिस? फ्रॉम आउटसाइड एक्टोडम. एक्टोडम. सो दिस आर द एक्टोडर्मल क्लेफ्ट. ये क्लेफ्ट है, क्लेफ्ट है, क्लेफ्ट है. एंड ये अंदर से कौन है? व्हाट आर दीज? एंडोडर्मल पाउचेस. एंड वी जॉइन दिस नाउ. ये है फर्स्ट pharyngeal आर्च, ये है सेकंड pharyngeal आर्च, थर्ड pharyngeal आर्च, फोर्थ pharyngeal आर्च एंड सिक्स्थ pharyngeal आर्च. तो कितने pharyngeal आर्चेस होते हैं? 6. एक डिसअपियर होती है, वन डिसअपियर्स ऑफ. अब कितने pharyngeal arch बचेंगे? 5 pharyngeal arch. Okay, now tell me, in the first pharyngeal arch, what is this? Students, if you can answer this, ये कौन है? And what is this? This you should know. यह है lingual swellings. And what is this known as? This is the lingual swellings. And this is what we call as the tuberculum impar. Lingual swellings and tuberculum impar. हाँ, फर्स्ट प्रोफ का भी कोर्स लॉन्च करेंगे बच्चों. जस्ट वेट. Our NEET PG is on the verge. It's very close. So a quick revision course for the NEET PG students. Huh? I hope you are understanding, all of you. चलो, दो lingual swellings and tuberculum impar. What is formed from here? इससे क्या बनता है बच्चों? What is derived from this? Two lingual swellings and tuberculum impar forms the anterior 2/3 of the tongue. Anterior 2/3 of the tongue. So anterior 2/3 of the tongue is derived from the two lingual swellings and tuberculum impar, which is a nerve of the first arch. Nerve of the first arch is lingual nerve. Lingual nerve. So the anterior, the nerve of the first arch is mandibular nerve. So anterior 2/3 of the tongue is supplied by a branch of mandibular, वो है lingual nerve. So first arch के nerve है mandibular nerve. So anterior 2/3 को कौन supply करेगा? Lingual nerve. ठीक है? In the third and the fourth arch, you get a prominence. इसका नाम क्या है बच्चों? What is this prominence known as? Cupula. Cupula. हाँ, इसको बोलते हैं cupula. फर्स्ट MBBS का कोर्स लॉन्च करेंगे बच्चों. जस्ट हैव सम पेशेंस. लॉन्च करेंगे. विल बी लॉन्चिंग एवरीथिंग फॉर यू. ओके, सो ये है क्यूपुला. इसके दो पार्ट्स होते हैं. दिस इज द क्रेनियल पार्ट एंड ये क्या होता है? कॉर्टल पार्ट है ना. सो क्यूपुला का दूसरा नाम है हाइपोब्रैंकियल एमिनेंस. Hypobranchial eminence. Okay. Yes, you'll get everything. You'll get the PDF also, bacha. You'll get everything. So first pharyngeal arch में क्या बनता है? दो lingual swellings, two lingual swellings, tuberculum impar. In the third and the fourth arch, you get the cupula. It is also known as the hypobranchial eminence. इसके दो parts होंगे. एक होगा cranial part and one is the caudal part. So cranial part is derived in which arch? Third arch, and caudal part is derived from the fourth arch. Okay, now you tell me, students, the cranial part of the hypobranchial eminence forms what? Posterior 1/3 of the tongue. So posterior 1/3 of the tongue is derived from the cranial part of hypobranchial eminence. Students, which is the nerve of the third arch? Glossopharyngeal, and that is how the posterior 1/3 of the tongue is supplied by glossopharyngeal nerve. ठीक है? And what is this now? The caudal part of the hypobranchial eminence. The caudal part of hypobranchial eminence से क्या बनेगा? The posterior most part of the tongue and epiglottis. ये कौन है? Epiglottis. Okay, so what I'm asking you, मैं पूछ रहा हूं, which is the epiglottis is derived from which pharyngeal arch? Epiglottis कौन से arch में develop होता है? Fourth pharyngeal arch. So which is the nerve of the fourth pharyngeal arch, students? The nerve of the fourth pharyngeal arch is superior laryngeal nerve. तो एक ब्रांच है सुपीरियर लैरिंजियल नर्व का. There's a branch of superior laryngeal nerve which is going to supply the posterior most part of the tongue. तो posterior most part of the tongue को कौन सप्लाई करेगा? Which branch of superior laryngeal? That's the internal laryngeal nerve. Internal laryngeal nerve. समझ में आ रहा है? So posterior most part of the tongue and the epiglottis, ये दोनों कौन से arch से बनते हैं? They are derived from the fourth pharyngeal arch. Which is the nerve of the fourth arch? Superior laryngeal. So who's going to supply the posterior most part of the tongue? It's a branch. एक branch होती है superior laryngeal की. That is the internal laryngeal nerve. Am I clear, students? Am I clear? Fine. Internal laryngeal. Very good. Very good, medicals. Yes, very good. Fine. So coming back to this, that's the epiglottis. What are these folds here? Bachcho, what are these folds here? These are the aryepiglottic folds. Aryepiglottic folds है ना ये. And what is this? This is the thyroid. Thyroid cartilage. Thyroid cartilage. So ये aryepiglottic folds on the medial side and the thyroid cartilage on the lateral side. There's a space between them. यहाँ पे एक space होती है. Aryepiglottic folds medially होते हैं. And thyroid is on the either sides. Lateral पे thyroid होता है. ये जो area है, that is known as the pyriform fossa. Pyriform fossa. It is also known as the smuggler's pouch. Smuggler's pouch. There's a nerve which comes here. यहाँ पे एक nerve आती है. Can anyone tell me which is the nerve which comes here in this pyriform fossa? चलो, ये बहुत important है. This is very important, बच्चों. शिफाना, what do you want? क्या चाहिए आपको? The nerve supply of tongue. देखो, aryepiglottic folds is medially. हाँ, ये aryepiglottic folds हो गए, and that's the thyroid cartilage. इनके बीच में the space between them is the pyriform fossa. इसको हम smuggler's pouch भी बोलते हैं, है ना? So which is the nerve which comes here, students? PDF will be there. PDF देंगे आपको. PDF देंगे आपको. Internal laryngeal. Very good. Very good. Yes, Jitin, very good. Which is the nerve which comes here? यहाँ पे एक nerve आती है, and that's the internal laryngeal nerve. Internal laryngeal nerve is a branch of superior laryngeal. यही मैं बोल रहा था आपको. Internal laryngeal is a branch of superior laryngeal, and this internal laryngeal nerve is going to pierce a membrane. एक membrane को pierce करती है ये internal laryngeal nerve. One moment, I'll just show you. See this. See this. ये देखिए बच्चों, ये membrane का नाम क्या है? What is this membrane? Any guesses? ये membrane का नाम क्या है? Any guesses? The internal laryngeal nerve pierces a membrane. What is the name of this membrane? बोलो 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 बच्चों. हाँ, ये membrane का नाम क्या है? This is the thyroid membrane. ये membrane का नाम है thyroid membrane, and it pierces the thyroid membrane and then it comes in the pyriform fossa. So ये thyroid membrane को कौन pierce करता है? Who's going to pierce the thyroid membrane? The internal laryngeal nerve and the superior laryngeal artery. Internal laryngeal nerve and superior laryngeal artery. ठीक है? So ये है thyroid membrane. एक बहुत common MCQ आता है. That's a very common MCQ. A person was eating a fish. हाँ, ये fish खा रहा है, fish. And जो fish का कांटा होता है, the thorn of the fish goes in the pyriform fossa. A person is having fish and the thorn goes in the pyriform fossa. वो जो कांटा होता है ना fish का, it enters the pyriform fossa. Which is the nerve affected? Which is the nerve affected? Internal laryngeal nerve. आपका आंसर होगा internal laryngeal nerve. I hope this is clear, बच्चों. एक है ना, एक फ्लो चार्ट बनाता हूं मैं आपके लिए. I'll just make a flow chart for you. बस ये फ्लो चार्ट याद रखिए, बहुत MCQs क्लियर होंगे. वेगस के दो ब्रांचेस होते हैं. वेगस गिव्स टू ब्रांचेस. वन इज द सुपीरियर laryngeal. Vagus gives two branches, superior laryngeal, and the other one is the recurrent laryngeal nerve. Okay, superior laryngeal and recurrent laryngeal. Superior laryngeal is a nerve which arch, fourth arch, and जो recurrent laryngeal होती है, it's a nerve which arch, sixth arch. Sixth arch. अब ये जो सुपीरियर लैरिंजियल है, इट pierces the thyrohyoid membrane. Thyrohyoid membrane. स्टूडेंट्स ये सब एमसीक्यूज हैं, ये सारे एमसीक्यूज हैं. इट pierces the thyroid membrane, passes between, ये कहां जाती है? इट passes between, हाँ, passes between the middle and inferior constrictors. सो ये मिडल एंड इंफीरियर कंस्ट्रिक्टर के बीच में से हु गोस? द इंटरनल लैरेंजियल नर्व passes between the middle and the inferior constrictors. ये सारे MCQs है, these are all MCQs, and it supplies larynx. It supplies the larynx above vocal folds. It supplies the larynx above the vocal folds. Yes, yes, I'll be teaching. Also supplies, ये और क्या सप्लाई करता है? Also supplies the posterior most part of the tongue. Also supplies, ये और क्या सप्लाई करेगा? Posterior most part of the tongue and epiglottis. ये क्लियर है बच्चा? Is this very clear to all of you? That's the complete superior laryngeal nerve. Superior laryngeal nerve divides into an external, एक मिनट, it divides into an external and internal laryngeal. One moment, एक मिनट. The superior laryngeal divides into external laryngeal and internal laryngeal. एंड ये जो इंटरनल लैरिंजियल नर्व है ना, ये करती है, ये इंटरनल लैरिंजियल नर्व है. सो इंटरनल लैरिंजियल नर्व क्या करता है? इट पियर्सेस द थायरोहायोइड मेम्ब्रेन. अब ये जाएगा पायरिफॉर्म फोसा के अंदर. अब ये मिडल एंड इंफीरियर कंस्ट्रिक्टर के बीच में से जाएगा. इट विल गो बिटवीन द मिडल एंड इंफीरियर कंस्ट्रिक्टर्स. नाउ इट सप्लाइज द लैरिंग्स अबाउट द वोकल फोल्ड्स. It also supplies the posterior most part of the tongue and epiglottis. Clear है बच्चों? It supplies the posterior most part of the tongue and epiglottis. Is this clear, students? Internal laryngeal nerve is clear to all of you? This is extremely important. Huh? This is very important. Huh? तो ये है internal laryngeal nerve. What does the external laryngeal nerve supply? The external laryngeal nerve, this session will go till 8:30. 6:30 to 8:30 पहला सेशन है. 8:30 to 8:45 break होगा. 8:45 to 10:45 is the second session. Yes. The external laryngeal nerve supplies. ये बोल सकते हो आप बच्चों. It supplies. What does it supply? The external laryngeal nerve supplies the cricothyroid. Cricothyroid. ये बहुत इंपॉर्टेंट है बच्चों. The external laryngeal nerve is going to supply which muscle? Cricothyroid. And what is the action of cricothyroid? It's a tensor of the vocal cords. Tensor of vocal cords. See, yeah, no, this all things are very important, bacha. Jitna important things I can give you, I'm trying to give. So what is the external laryngeal nerve supply? It supplies the cricothyroid. ये cricothyroid का action क्या होता है? It's a tensor of the vocal cords. Okay, it's a tensor of the vocal cords. And जब ये tensor action होता है, when the vocal cords are tensed, what happens? You get a pitch to the voice. You talk in a high pitched voice. एकदम जोर से आप बोलते हो, in a loud voice. And this is because of cricothyroid. This is because of external laryngeal nerve. External laryngeal nerve. Clear? So that's, it supplies the cricothyroid. What is the action of cricothyroid? It's a tensor of vocal cords. And when this cricothyroid is damaged, damage results in loss of, ये एमसीक्यू आया था, लॉस ऑफ टिम्बर, लॉस ऑफ टिम्बर ऑफ द वॉइस, लॉस ऑफ टिम्बर ऑफ द वॉइस, TIMBAR. What is this? ये क्या होता है? टिम्बर क्या होता है? When the vocal cords cannot be tensed, when you don't get a pitch, वो high pitched voice नहीं होता है, उसे हम बोलते हैं loss of timbre of the voice. Is this clear? Yes, low pitched voice. Very good, very good. Topical, very good. ये क्लियर है? सो सुपीरियर लैरिंजियल नर्व क्लियर है? इस पे बहुत एमसीक्यूज हैं बच्चों. जस्ट रिमेंबर दिस इंटरनल लैरिंजियल नर्व. ये सब पॉइंट्स जो मैंने दिए हैं, दिस आर ऑल एमसीक्यूज. All these points that you have written are all MCQs. Very good, very good. Now coming to the recurrent laryngeal nerve. Students, recurrent laryngeal nerve. What happens to it? It passes below the inferior constrictor. Passes below inferior constrictor. Okay, crystal clear. Very good. It goes below the inferior constrictor. अब ये क्या सप्लाई करेगा? It supplies all the muscles of the larynx. It supplies all the muscles of larynx except cricothyroid. It supplies all the muscles of larynx except the cricothyroid. ठीक है? All the muscles except cricothyroid. It also supplies sensory supply below the vocal folds. Below the vocal folds. It also supplies sensory supply below the vocal folds. That's it. I hope this is clear to all of you students. Perfect. This is a very important flow chart. ये flow chart मैंने आपको दे दिया. This is a very important flow chart. Clear? So that's a complete vagus for you. Yes, infraglottic larynx. बराबर. ठीक है? I'll proceed to the next MCQ. Okay, just have a look at this slide. Yeah, number 7. Students, come on, answer this MCQ. A 50 years old male comes to the clinic with decreased taste sensations. So quickly tell me, anterior 2/3 of the tongue, who supplies taste sensations in the anterior 2/3? Chorda tympani. Taste sensations in the posterior 1/3, कौन supply करता है? Glossopharyngeal. And taste sensations in the posterior most part of the tongue, who supplies? Internal laryngeal nerve. You know this. Chalo. So 50 years old male comes to the clinic with decreased taste sensations. On examination, sensations were not felt on the posterior part of the tongue. Posterior 1/3 of the tongue. Lesion of glossopharyngeal nerve was suspected. One of the following statement about this nerve is false. What is the answer for this? Any guesses? Yes, what is the answer for this? Any guesses? Any guesses? Yes, answer is C for this. C. Answer is C. Contains no general visceral efferent fibers. Okay, let us discuss about this glossopharyngeal nerve. बच्चों, glossopharyngeal nerve is very important. Very important. Facial nerve, glossopharyngeal nerve, बहुत MCQs आते हैं. So बच्चों, if you can tell me glossopharyngeal nerve, चलो systematically जाते हैं. We'll go systematic. Glossopharyngeal nerve, nucleus of glossopharyngeal nerve. ये glossopharyngeal nerve क्या supply करता है? What does a glossopharyngeal nerve supply? चलो answer this. Glossopharyngeal nerve supplies a muscle of third arch, है ना? Glossopharyngeal nerve supplies a muscle of third arch. What is the name of the muscle? वो third arch का muscle क्या है? Stylopharyngeus, है ना? Glossopharyngeal nerve supplies the stylopharyngeus. To supply the muscle of the third arch, व्हाट इज द नेम ऑफ द कॉम्पोनेंट? वो कौन सा कॉम्पोनेंट है ग्लॉसोफेरेंजियल नर्व के पास, फंक्शनल कॉम्पोनेंट टू सप्लाई द स्टाइलोफेरेंजियस मसल? स्टूडेंट्स आंसर. The name of the component is special visceral efferent component. Special visceral efferent. And what is the name of the nucleus? What is the name of the nucleus belonging to this component? वो कौन सा न्यूक्लियस है ग्लॉसोफेरेंजियल नर्व का which is going to supply the stylopharyngeus muscle? Any guesses? Any guesses बच्चों? What is the name of the nucleus of glossopharyngeal nerve? वो कौन सा न्यूक्लियस है ग्लॉसोफेरेंजियल नर्व को जो स्टाइलोफेरेंजियस को सप्लाई करेगा? बोलिए. That's the nucleus. स्पेशल विसरल इफरेंट है. हाँ, न्यूक्लियस का नाम, न्यूक्लियस का नाम, न्यूक्लियस का नाम. हाँ, यस, वेरी गुड सुखबीर, वेरी गुड. उसका नाम है न्यूक्लियस एम्बिगुअस. Nucleus ambiguous. The name of the nucleus is nucleus ambiguous. Clear है? अब what else is the glossopharyngeal nerve supply? Glossopharyngeal nerve और क्या supply करता है? Glossopharyngeal nerve supplies the parotid gland, है ना? ये parotid gland को supply करता है glossopharyngeal nerve. अब parotid gland को supply करने के लिए what is the name of the component? वो कौन सा component है जो parotid gland को supply करेगा? General visceral efferent. General visceral efferent. And iska nucleus, what is the name of the nucleus which belongs to the general visceral efferent component? In other words, what is the name of the nucleus of the glossopharyngeal nerve जो parotid gland को supply करेगा? The name of the nucleus is inferior salivatory nucleus. Inferior salivatory nucleus. Very good, very good. Inferior salivatory nucleus. Glossopharyngeal nerve supplies the tongue. Special sensations to the posterior 1/3 of the tongue. So what is the component? वो component कौन सा है which supplies the tongue? Special visceral afferent. Special visceral afferent. मेडिको बच्चा, सुपीरियर सलाइवेटरी एंड लैक्रिमेटरी न्यूक्लियस फेशियल नर्व का होता है. वो फेशियल नर्व का न्यूक्लियस होता है, सुपीरियर सलाइवेटरी एंड लैक्रिमेटरी न्यूक्लियस, जो बाकी ग्लैंड्स को सप्लाई करेगा, which supplies rest of the glands. What is the name of the nucleus of glossopharyngeal nerve which is going to supply the parotid? Inferior salivatory nucleus. Inferior salivatory nucleus. Glossopharyngeal nerve और क्या सप्लाई करता है? टंग. So वो कंपोनेंट का नाम क्या है? स्पेशल विसरल एफरेंट. एंड न्यूक्लियस का नाम बोलो बच्चों, न्यूक्लियस का नाम बोलो. The name of the nucleus is nucleus of tractus solitarius. समझ में आ रहा है? That's the nucleus of tractus solitarius. यही है क्रेनियल नर्व्स के कॉलम्स है. ओके, क्रेनियल नर्व्स के कॉलम्स में बाद में एक्सप्लेन करता हूं. I'll explain, हाँ, जितना हो सकता है I'll try to explain now, then later I'll again explain. So बच्चों, ग्लॉसोफेरेंजियल नर्व के न्यूक्लियस कौन से होते हैं? One is the inferior salivatory nucleus. And what is this going to supply? ये क्या सप्लाई करेगा? Parotid gland. Second nucleus, nucleus ambiguous. ये क्या सप्लाई करेगा? Stylopharyngeus. तीसरा nucleus is the inferior salivatory nucleus. And ये क्या सप्लाई करेगा? Parotid gland. Clear to all of you? Okay. Now see this. ये जो brainstem है, this is, बच्चों, have a look at this. ये है midbrain. Sorry. ये है midbrain. यह है pons, and that's the medulla. What is this in the medulla? ये brainstem मैंने draw किया. This is one. ये second one है, and that's the third one. Anyone? What is this that I've drawn? Another very important MCQ है. ये बहुत important MCQ है. ये है brainstem. What is this? Midbrain. ये कौन है? pons. एंड ये कौन है? मेडुला, है ना? ये मेडुला है. What is this that I've drawn? ये है middle cerebellar peduncle. ये क्या होता है? What is this? Number 1, number 2, number 3. Number 1 क्या है? Anyone? बोल सकते हैं? What is number 1? Pyramids. Number 2, olives. Number 3, inferior cerebellar. Refresh करिए, just refresh it. Peduncle. Inferior cerebellar peduncle. Okay. सो ये एंटीरियर एस्पेक्ट ऑफ ब्रेन स्टेम है बच्चों, ये आगे से देख रहे हो, ये लुकिंग फ्रॉम फ्रंट, हाँ, सामने से देख रहे हो. सो दिस इज द मिड ब्रेन, द फर्स्ट इज द मिड ब्रेन, दैट्स द पॉन्स एंड दैट्स द मेडुला. हाँ, अब मेडुला में नंबर 1 इज द पिरामिड, नंबर 2 इज द ऑलिव एंड नंबर 3 इज द इंफीरियर सेरेबेलर पेडंकल. ओके, what is this? This is the middle cerebellar peduncle. Now tell me bacha, what is this cranial nerve? What is this number? What is this cranial nerve? And what is this cranial nerve? Chalo, answer this. Which are the cranial nerves attached to the midbrain? Anyone? Which are the cranial nerves attached to the midbrain? Any guesses? Cranial nerves attached to the midbrain, that's the third nerve, that's the fourth nerve. Third and fourth. ये कौन सा nerve है? The nerve attached at the junction of the pons with the middle cerebellar peduncle. Lag हो रहा है? Okay, is this fine? The third and the fourth nerves are attached to the midbrain. The nerve attached at the junction of the pons with the middle cerebellar peduncle, ये है fifth nerve. फिफ्थ. ये सब MCQs है स्टूडेंट्स, दीज आर ऑल वेरी इंपॉर्टेंट MCQs, ये बहुत इंपॉर्टेंट MCQs है. सो द नर्व अटैच्ड एट द जंक्शन ऑफ पॉन्स विद द मिडिल सेरेबेलर पेडंकल इज फिफ्थ. यहाँ पे 3 नर्व्स होते हैं, दिस इज वन, सॉरी, यह है सिक्स्थ, यह है सेवेंथ एंड यह है एट्थ. सिक्स्थ, सेवेंथ, eighth. So the nerves attached at the pontomedullary junction. हाँ आदर्श, लैग हो रहा है? Now it's okay, no? हाँ, the nerve attached at the pontomedullary junction. ये कौन से nerves है? Sixth, seventh, eighth. ये बहुत इंपॉर्टेंट है बच्चा, बहुत इंपॉर्टेंट है. Nerve attached at the pontomedullary junction, sixth, seventh, eighth. So medial most nerve attached to the pontomedullary junction. बोल सकते हो? Medial most nerve attached to the pontomedullary junction is sixth nerve. Lateral most nerve attached to the pontomedullary junction is eighth nerve. ठीक है? Now, what is this nerve between the olives and the inferior cerebellar peduncle? What are these nerves between the olives and the inferior cerebellar peduncle? That's the 9th, 10th and 11th. 9th, 10th and 11th. And between the pyramids and the olives, what is this nerve? Number 12. यह है number 12th nerve. Number 12. I hope this is clear to all of you students. Okay. So, to the midbrain, which are the nerves attached to the midbrain? The third and the fourth nerves are attached to the midbrain. The nerve attached at the junction of the pons with the middle cerebellar peduncle is fifth nerve. MCQ ऐसे ही आता है. The nerve attached at the junction of pons with the middle cerebellar peduncle is the fifth nerve. Nerve attached to the pontomedullary junction, sixth, seventh, eighth nerve. The nerves between the pyramids and the olives, 12th nerve. And the nerve between the olives and the inferior cerebellar peduncle is the 9th, 10th and 11th nerves. 9th, 10th and 11th. ये clear है? Is this clear to all of you? Is this clear to all of you? Okay. So where is the glossopharyngeal nerve attached, students? The glossopharyngeal nerve is attached between the olives and the inferior cerebellar peduncle. है ना? First and second directly go to the brain. They directly go to the brain. First and second, they directly go to the brain. ठीक है? एक और चीज है बच्चा, just understand this. ये jugular foramen है. Okay, very good. That's a jugular foramen. इसके 3 compartments होते हैं. There are 3 compartments of the jugular foramen: anterior, middle, and posterior. There are 3 compartments of the jugular foramen. Okay, three compartments of the jugular foramen: anterior, middle, posterior. अब बोलो बच्चों, what passes to the anterior compartment? Another extremely important MCQ, students. Extremely important MCQ. What passes to the anterior compartment of the jugular foramen is the inferior petrosal sinus. Inferior petrosal sinus. What passes to the middle compartment? Ninth, 10th, and 11th cranial nerves. 9th, 10th, and 11th cranial nerves. 12th nahi bacha, 12th nahi. Shifana, not 12th. 12th will go through the hypoglossal canal. है ना? 12th will get out through the hypoglossal canal. So what passes to the middle compartment? The 9th, 10th, and the 11th cranial nerves. And what passes to the posterior compartment? Posterior compartment is the sigmoid sinus. What passes to the posterior compartment is the sigmoid sinus. Is this clear, students? Jugular foramen, very important. Anterior compartment is the inferior petrosal sinus. Middle compartment is the 9th, 10th, and 11th cranial nerves. And the posterior compartment is the sigmoid sinus. अब जब ये sigmoid sinus will get out through the posterior compartment, इसे क्या बोलोगे? जब ये sigmoid sinus posterior compartment से बाहर निकलती है, it gets out through the posterior compartment, क्या बोलते हो? What is it known as? What is it known as? Students, answer. What is it known as? Internal jugular vein. It is known as the internal jugular vein. Okay, so when the sigmoid sinus gets out through the posterior compartment of the jugular foramen, it is known as the internal jugular vein. Okay, okay, very good, very good, very good, students. Chalo, answer this. Answer this MCQ now. Just one moment. Chalo, answer this. So, one of the following statement about this nervous falls supplies the stylopharyngeus. Yes, it supplies the stylopharyngeus muscle. Stylopharyngeus muscle is a muscle of which pharyngeal arch? Third pharyngeal arch. Attached to the brainstem between the olives and the inferior cerebellar peduncle. Correct? Yes, that's correct. It's between the olives and the inferior cerebellar peduncle. Enters the jugular foramen. Yes, which compartment of the jugular foramen is that? The middle compartment of the jugular foramen. Contains no general visceral efferent. This is wrong. General visceral efferent is wrong. Okay. Okay, it will be okay. It will be okay now. What is this general visceral efferent supply? The general visceral efferent is going to supply the parotid gland. है ना? General visceral efferent क्या supply करता है? Parotid gland को. So contains no general visceral efferent is wrong. Is it clear, bacha? Is it clear to all of you? Any doubts in this MCQ? Perfect. Crystal clear. Yes, Iqbal, clear? Very good, very good. I'll proceed. चलो एक और MCQ देख लेते. Number 8. MCQ number 8. Identify this, bacha. Come on, if you can identify this structure. Okay, sorry. Just one moment. Huh? Okay, identify this foramen. Yes, that's good. Very good. That's foramen ovale. नहीं नहीं नहीं. That's foramen ovale नहीं है बच्चा. That's not foramen ovale. That's not foramen ovale. Foramen ovale नहीं है वो. ये है foramen ovale. देखो बच्चों, this is foramen ovale. ये foramen ovale. What is that mark structure? What is this mark structure? Lacerum नहीं है. That's not lacerum. ये lacerum नहीं है. This is the foramen spinosum. Very good, very good. ये है foramen spinosum. That's the foramen spinosum. And what passes through the foramen spinosum? What passes through the foramen spinosum? The middle meningeal artery. Middle meningeal artery and nervous spinosus. Nervous spinosus. The middle meningeal artery and the nervous spinosus passes through the foramen spinosum. Okay, अब मैं label करता हूँ. I'll just label this for you. You tell me what are these foramen. Tell me what is this number 1. Number 1. ये क्या foramen है? What is this foramen? Number 1. Yes, very good to all of you. Very nice. You're answering very well prepared you are. Okay, एक final touch है ये. Okay, this is a final brushing, final touch given by the PW team for you, specially for all of you. So bolo bachcho, what is this number 1? That's the optic canal. Number 1 is the optic canal. And what passes to this? The optic nerve and the ophthalmic artery. Optic nerve and ophthalmic artery. So number 1 is the optic canal. What is this number 2? Just the important foramens दिखा रहा हूं मैं. Important foramen. What is this number 2? Number 2 is foramen. Answer this. Foramen. Number 2. Rotundum. Number 2 is foramen rotundum. ये जो number 2 है ना, that's foramen rotundum. What passes through the foramen rotundum? Maxillary nerve. Maxillary nerve passes through the foramen rotundum. This number 3 is foramen ovale. Number 3 is foramen ovale. And what passes to foramen ovale? Male structures है ना, ये आपको पता है. Mandibular nerve, accessory meningeal artery, lesser petrosal nerve and the emissary vein. ठीक है. Male, mandibular nerve, accessory meningeal artery, lesser petrosal nerve and emissary vein. This is number 4. That's foramen spinosum. Number 4 is foramen spinosum. What passes to this is the middle meningeal artery and the nervous spinosus. Middle meningeal artery and the nervous spinosus. This is number 5. What is this, students? This is the foramen lacerum. Number 5 is foramen lacerum. And what passes through the foramen lacerum is the internal carotid artery. Internal carotid artery passes through the foramen lacerum. What is this foramen? ये बोल सकते हो number 6. Students, answer this. ये क्या foramen है? Answer this. Number 6. Come on, students. What is that number 6 foramen? That's the internal acoustic meatus. Internal acoustic meatus. Number greater petrosal nerve भी जाती है. Greater petrosal nerve also. So number 6 is the internal acoustic meatus. And what passes to the internal acoustic meatus is the 7th nerve, the 8th nerve and the labyrinthine artery. Correct? 7th nerve, 8th nerve and the labyrinthine artery. अब ये कौन है? Number 7. यह है jugular foramen. Jugular foramen है ना. अभी मैंने बोला है आपको jugular foramen. Number 8 is foramen magnum. ये क्या है? Number 9. Number 9 is the hypoglossal canal. Number 9 is the hypoglossal canal. Is this clear to all of you? The various foramens clear है? Students, Fine. Okay, fine. Perfect. Perfect, perfect, perfect. See the next MCQ. Is this clear to all of you? Perfect. Chalo, we'll just finish this one last MCQ and then we'll stop and then we'll go after the break. During our first prof exam, male structure is clear now to all of you? Huh. Entertainment, you will have a separate batch, don't worry. Okay, during the first prof exams, the anatomy professor asks a simple question. 8:30 break, asks a simple question. Which of the following joints is involved in turning the neck to the opposite side? Easy, eh? So which joint is turning the neck to the opposite side? What is this joint? Atlantoaxial joint. Very good, very good. You got this. Atlantoaxial joint. And atlantoaxial joint, what is the type of joint? बोल सकते हो, what is the type of joint? Atlantoaxial joint. What is the type of joint? Is the pivot joint. Pivot joint. Atlantoaxial joint is pivot type of synovial joint. Atlanto-occipital joint, यहाँ पे कौन से मूवमेंट्स होते हैं? नो मूवमेंट्स है ना? No movement takes place at this joint. What is this joint? Atlantoaxial joint. That's a pivot type of synovial joint. And which are the movements which takes place? The no movement. The yes movement takes place at which joint? Yes movement takes place at atlanto-occipital joint. यह है yes movements. What is the type of joint? बोल सकते हो? What is this type of joint? Students, what is this type of joint? This is a condylar joint. Condylar. Atlanto-occipital joint is a condylar type of synovial joint. Condylar type. Condylar type of synovial joint. Is this clear, students? Still here? यहाँ तक कुछ doubts है तो बोलिए. Is there any doubt still here that you have? Yes, yes, we'll be launching the other batches. Atlanto-occipital joint is condylar joint. उसे ellipsoidal joint भी बोलते हैं. Condylar या ellipsoidal joint. हाँ? Any doubts, बच्चों? Till here? Any doubts you have till here? So this is a special effort taken by the PW team for you students. A final revision of the PYQs and important topics just before the NEET exam. I hope you are enjoying this lecture. Enjoying the lecture? Any doubts? You'll be getting the PDF of this. You can follow PW Med Ed on our Telegram channel. You'll be getting everything. Huh? You'll be getting the PDF, you'll be getting the notes, everything you'll be getting. Okay. The regular batches will start within some time. The regular batches will start. The schedule will be announced to you. I hope things are clear to you, students. This is the schedule that we have put for you for this a quick revision. We call this a Sprint 2023, specially for you. This is the revision schedule for you. Swapnil, the date will be told to you. Wait, no. The date will be told to you. ठीक है? कुछ डाउट्स है यहाँ तक तो बोलो. I still have got 2-3 minutes to go. अगर यहाँ तक कुछ डाउट्स है तो बोलो. Swapnil, the details will be told to you. Just wait. अभी I can't tell you, no. The details will be told. Okay, ये पूरा schedule है आपके लिए. Samayak, male is clear. Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. The lecture is not over. Lecture is not over. You take a break of 15 minutes and then we start at 8:45. The lecture will begin at 8:45. Huh? 8:45 p.m. बस ये सारे इंपॉर्टेंट टॉपिक्स ने हेड एंड नेक के कवर किए. एंसिल, Vagus gives two branches, main branches, superior laryngeal, recurrent laryngeal. Superior laryngeal gives external laryngeal, internal laryngeal. External laryngeal nerve supplies the cricothyroid. What is the action? इसका action क्या है? Tensor of vocal cords. And जब ये vocal cords tense होते हैं, the pitch of the voice is gained. Internal laryngeal nerve pierces the thyroid membrane, supplies the mucous membrane above the vocal folds. Recurrent laryngeal nerve supplies all the muscles except cricothyroid. It supplies sensory supply below the vocal folds. ठीक है? हाँ, link is the same. I'm not closing. Ligaments of C1, C2. C1, C2 के लिगामेंट क्या है? एक लिगामेंटम फ्लेवम होता है. लिगामेंटम फ्लेवम जो स्पाइन्स के अंदर होता है, स्पाइन्स के बीच में होता है ना, दैट इज लिगामेंटम फ्लेवम. Then there's a ligament which connects the two, the lamina. Ligamentum nuchae is in the spines. Ligamentum flavum connects this lamina of the vertebrae. Ligamentum flavum, ये याद रखना. Then anterior longitudinal ligament होता है जो आगे होता है, and एक posterior longitudinal ligament होता है which is behind the bodies of the vertebrae. एक मिनट, I'll just tell you this. ये देखो, ये है ना, this is the body of the vertebrae. ये body of the vertebrae है. This is the lamina and ये spine है ना, ऐसे spine होता है, बराबर. That's a transverse process. आगे है ना, body के आगे, what is this ligament? Anterior longitudinal ligament. Body के पीछे होता है posterior longitudinal ligament. The ligament in the spine is known as ligamentum nuchae. Ligamentum nuchae. And the ligament which is present, यहाँ पे एक vertebral canal भी होगा ना, that's a vertebral canal. This is the lamina and यहाँ पे होता है ligamentum flavum. Ligamentum flavum. So all the bodies of the vertebrae, आगे की तरफ, that's anterior longitudinal ligament. पीछे की तरफ, that's the posterior longitudinal ligament. In the spines of the cervical vertebrae, that's the ligamentum nuchae. And in this lamina, adjacent lamina, that's the ligamentum flavum. Okay, I hope this is clear to all of you students. We'll meet at 8:45. We'll meet at 8:45 p.m. Okay. Thank you to all of you. Thank you to all of you. Okay. So hello. Okay. So hello, we'll start. Okay, chalo, we'll start now. Chalo students, number 10. So 9 MCQs are done. We'll start. A 60 years old female was diagnosed with papillary carcinoma of the thyroid gland. Carcinoma of thyroid. The patient complains of breathlessness. The upward extension of thyroid is prevented by which of the following structures attached to the thyroid cartilage? Yes, any guesses? You'll enjoy the next 2 hours also, Bhavik. Uh, Bhavuk? Yes, any guesses to this answer? Any guesses, students? Hello, 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 Shivam. Sternothyroid. Answer is sternothyroid. Yes. So sternothyroid begins from the sternum and it is attached to the thyroid cartilage, the oblique line of thyroid cartilage. And this sternothyroid answer, this sternothyroid prevents the upward growth of the thyroid cartilage. It's not pretracheal fascia, it's the sternothyroid muscle, sternothyroid. Pretracheal fascia nahi hai. Answer is sternothyroid for this. Sternothyroid. Pretracheal fascia encloses the thyroid gland. It encloses the thyroid gland, it encloses the trachea, and this pretracheal fascia is continuous with the superior mediastinum. It enters the thorax, it is continuous with the superior mediastinum. Ligament of Berry is attached to the cricoid cartilage. Okay, see, the apex of the thyroid gland is attached to the thyroid cartilage. The base of the thyroid gland goes to the tracheal rings, right? The second to fourth tracheal rings. So ligament of Berry is attached to the cricoid cartilage. It prevents the falling down of thyroid gland. It prevents the falling down of thyroid gland. What is thyrohyoid membrane? The thyroid membrane is between the thyroid and the hyoid bone and the thyroid cartilage. And this thyrohyoid membrane is pierced by what? See, bacha, pretracheal fascia is attached to the hyoid bone. It is attached to the hyoid bone. It encloses the trachea. It encloses the thyroid gland. It is attached to the hyoid bone. So it is not going to stop the upward growth of thyroid gland. Understand, the pretracheal fascia is attached to the hyoid bone. So it is not going to prevent the upward growth of thyroid gland. The upward growth is prevented by a muscle which starts from the sternum and it is attached to the thyroid cartilage, and that is sternothyroid. Sternothyroid. Clear, Mangesh? Okay, this thyroid membrane is pierced by internal laryngeal nerve. Internal laryngeal nerve and the superior laryngeal artery. You know this, internal laryngeal nerve and superior laryngeal artery. Is this clear to all of you? Mangesh, clear है ना ये? सबको clear है? Pretracheal fascia, ऊपर it is attached to the hyoid bone and नीचे it goes in the mediastinum. It goes till the superior mediastinum के तक जाता है ये. That's a pretracheal fascia. Okay, fine. So that's it. Okay, that's number 10. Anything else? Tell me, the superior thyroid artery accompanies which nerve? Come on, students. Superior thyroid artery accompanies which nerve? Yes, Shashank, you'll be getting this. You'll be getting the PDF. Superior thyroid artery accompanies. बोलिए बोलिए बोलिए. Superior thyroid artery accompanies which nerve? External laryngeal nerve. External laryngeal nerve. And the inferior thyroid artery accompanies the recurrent laryngeal nerve. You know this. You know this, no? The superior thyroid artery accompanies the external laryngeal nerve and the inferior thyroid artery accompanies the recurrent laryngeal nerve. Okay, that's it. That's about the thyroid gland. Okay, fine. That's nothing else here. Number 11, identify the pointed structure. This one. Identify this pointed structure. Anyone? What is this pointed structure? Yes, very good, very good. Very good to all of you. What is this pointed structure? ये कौन है? What is this pointed structure? Yes, yes, you got this right. Very good. That's the that's the that's the fornix. Fornix. Very good. ये structure है fornix. Fornix. You know, ये fornix इतना ही दिखता अपने को. The fornix is seen this much only. But you know, where does this fornix begin from? Where does this fornix begin from? The fornix begins from, you know, there's something known as hippocampus. Hippocampus alveus. Alveus से बनता है फिम्ब्रिया. फिम्ब्रिया से बनता है fornix. The fornix goes and relays in mammillary body. The fibers go to thalamus and through the cingulate gyrus. Okay, ये cingulate gyrus से it goes to हिप्पोकैम्पस की तरफ जाता है. सो हिप्पोकैम्पस, ये हिप्पोकैम्पस होता कहाँ पे है? ये हिप्पोकैम्पस कहाँ पे होता है? दिस इज लोकेटेड इन द टेम्पोरल लोब. टेम्पोरल लोब है ना. ये हिप्पोकैम्पस होता है टेम्पोरल लोब के अंदर. फ्रॉम दिस हिप्पोकैम्पस, हिप्पोकैम्पस एक ग्रे मैटर होता है बच्चा. हिप्पोकैम्पस इज द ग्रे मैटर. फ्रॉम द हिप्पोकैम्पस व्हाट बिगिंस इज, हाँ, हिप्पोकैम्पस से क्या बिगन होता है? वो फाइबर्स को बोलते हैं एल्वियस, है ना. हिप्पोकैम्पस ग्रे मैटर है. सो ग्रे मैटर से जो फाइबर्स बनते हैं, द फाइबर्स आर नोन एज एल्वियस. एल्वियस का बनेगा फिम्ब्रिया. फिम्ब्रिया. अब फिम्ब्रिया का बनेगा फॉर्निक्स. अब ये फॉर्निक्स कहाँ जाएगा? वेयर विल द फॉर्निक्स गो? टू द मैमिलरी बॉडीज. Mammillary bodies say it will go to the thalamus, and from the thalamus the fibers जो है they will go through the cingulate gyrus, ये वापस hippocampus में जाते हैं. बच्चों, what is this? What is this? इसे क्या बोलते हो? What do you call this as? What is this known as? ये मैंने क्या लिखा है? What is this known as? एनी गेसेस? ये क्या है? व्हाट इज दिस? कम ऑन, गेस दिस, गेस करिए. हिप्पोकैम्पस, हिप्पोकैम्पस से बनता है एल्वियस, एल्वियस से बना फिम्ब्रिया, फिम्ब्रिया से बना फॉनिक्स, फॉनिक्स गोज इन द मैमुलरी बॉडीज, फिर ये थैलेमस में जाएगा एंड फ्रॉम द थैलेमस इट गोज बैक टू द हिप्पोकैम्पस. व्हाट इज दिस? व्हाट इज दिस? बोलो बच्चों, बोलो. कम ऑन, कम ऑन, कम ऑन. व्हाट इज दिस नोन एज? इसे बोलते हैं पैपिस सर्किट. वेरी गुड, वेरी गुड, वेरी गुड. दिस इज व्हाट वी कॉल एज द पैपिस सर्किट. एंड दिस पैपिस सर्किट इज responsible for, it is responsible for emotions, emotions and recent memory. This papis circuit is responsible for emotions and recent memory. ठीक है? So ये है papis circuit. So hippocampus, alveus, fimbria, fornix, mammillary bodies, thalamus, thalamus से back to the hippocampus. This circuit is known as the papis circuit, and this papis circuit is responsible for emotions and recent memory. Clear है? Clear है students? Okay. So look at this slide. ये देख लीजिए. So hippocampus यहाँ पे होता है नीचे. From the hippocampus ये ऐसे है ना, alveus बनता है. Alveus का बनेगा fimbria. Fimbria का अब ये क्या है? What is this? This is known as the fornix. Fornix. The fornix will go in the mammillary bodies. Mammillary bodies. Mammillary bodies से ये जाएगा thalamus में, and from the thalamus it will go through the cingulate gyrus. From the thalamus it will go through the cingulate gyrus back to the hippocampus. यह है papis circuit. Is this clear, students? Okay, fine. Clear to all of you? Very good, very good. Sorry. Fine. What is this? This is the corpus callosum. ये corpus callosum है. Can anyone tell me what are the types of fibers in corpus callosum? What are the types of fibers? Corpus callosum. Anyone? 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 White matter of the brain. White matter of the brain is divided into three types of fibers. And it is divided into three types of fibers. One is the projection. Second is the commissural. And the third one is the association fibers. Association fibers. So projection fibers, commissural fibers and association fibers. Association fibers क्या connect करते हैं? What do the association fibers connect? The association fibers connect different areas in the same hemisphere. Different areas in the same hemisphere. Example, different areas in the same hemisphere. Example, uncinate fasciculus. इसका example है uncinate fasciculus. So association fibers will connect different areas in the same hemisphere. And this example is uncinate fasciculus. Students, what does an uncinate fasciculus connect? This is a very important MCQ. Uncinate fasciculus connects which two lobes, which two areas? बोल सकते हो? Yes. Uncinate fasciculus connects which areas? It connects the Broca's and Wernicke's area. It connects the Broca's and Wernicke's area. Okay, so one example I've given you. One is uncinate fasciculus. The second example is the superior longitudinal fasciculus. Superior longitudinal fasciculus. Yes. Commissural fibers. Commissural fibers क्या connect करते हैं? They connect similar areas in the opposite hemisphere. Similar areas in the opposite hemisphere. Example is corpus callosum. Largest commissural fiber is corpus callosum. और कुछ है? Any other examples of commissural fiber? Anterior commissure. posterior commissure, anterior commissure, posterior commissure, corpus callosum. These are all examples of commissural fibers. Projection fibers, example is internal capsule. Internal capsule. ठीक है. Fornix is said to be a projection fibers. Fornix को दोनों टाइप में इंक्लूड करते हैं. Fornix is included in the projection fiber also. Fornix is also included in the commissural fibers. Remember, students. Clear to all of you? So this is the white matter of the brain. Projection fiber, commissural fiber, association fiber. Okay, I hope this is clear to all of you. White matter of the brain. Anything else seen in the slide? Students, can you quickly identify this? What is this that I have pointed? एक मिनट. ये क्या है? ये क्या है? बच्चों, what is this? What is this area? What is this area that I have pointed? Come on, students, answer. What is this area? That's a fourth ventricle. Fourth ventricle, ये है pineal gland, right? That's a pineal gland. Okay, so that's it. Which is the artery present here? Can anyone answer this? The artery which is present in the callosal sulcus. Here. What is the artery present in the callosal sulcus here? Any guesses? Come on. Artery present in the callosal sulcus. That's a very important MCQ. Students. Artery present in the callosal sulcus is? Answer this. Anterior cerebral artery. Artery present in the callosal sulcus is the anterior cerebral artery. I'll just make this for you. Look, this is the brain here. That's a brain. This is the lateral surface. What is this surface? This is the medial surface of the brain. That's a lateral surface. That's a medial surface of the brain. What is the artery which is present here known as? Okay, what is the artery present in the lateral sulcus known as? Middle cerebral artery. What is the artery present in the callosal sulcus known as? In the callosal sulcus lies the anterior cerebral artery. This is a very important MCQ. The artery present in the lateral sulcus is middle cerebral artery. The artery present in the callosal sulcus is anterior cerebral artery. Okay, so now this anterior cerebral artery will supply the entire medial surface. ये सारा medial surface को supply करेगा. अब ये anterior cerebral जो है, it will go on that side. वो side जाएगा. It will go on the supralateral surface. It will supply a small area here on the supralateral surface. So small area on this surface is supplied by whom? Anterior cerebral artery. The entire supralateral surface is supplied by which artery? The entire supralateral surface is supplied by middle cerebral artery. Medial side pe this part is supplied by middle cerebral artery, and the occipital lobe is supplied by what? Posterior cerebral artery. Posterior cerebral. ठीक है? Is this clear to all of you? A very important MCQ. Very important MCQ. ठीक है? Thank you, sir. Thank you. So artery present in the lateral sulcus is middle cerebral artery. Artery present in the callosal sulcus is anterior cerebral artery. So bachcho, if you can quickly tell me what is the blood supply of the motor area? Chalo, answer this. What is the blood supply of the motor area? Blood supply of motor area. Motor or sensory area? Answer this. This is a very important MCQ. चलो बच्चों बोलो. Come on. Blood supply of the motor area or sensory area. ये आंसर कर लो, then I'll explain. Bhavuk, you answer this. Blood supply of the motor area or sensory area. देखो, ये सेंट्रल सल्कस है, ये सेंट्रल सल्कस है, that's a pre-central sulcus, that's a post-central sulcus. So this much part, itna part is supplied by whom? Middle cerebral artery. And this part is supplied by whom? Anterior cerebral artery. So agar MCQ aata hai, bachcho, if the MCQ comes blood supply of the motor area or the sensory area, your answer is going to be two arteries, anterior and middle cerebral artery. ये MCQ आया था, ये MCQ पूछा था. So blood supply of the motor or sensory area is ACA plus MCA. MCA and ACA, because the major part is supplied by which artery? MCA, and the top part is supplied by whom? Anterior cerebral artery. So blood supply of motor. That's good, Gautam. That's good. You have written very nice name. So blood supply of the motor or sensory area is anterior and middle cerebral. ये clear है बच्चों? Is this clear? दो arteries है. Is this clear to all of you? And if you can quickly answer this, blood supply of occipital lobe. Blood supply of the occipital lobe or visual area. Answer this. This is another very important MCQ, students. Hello? Come on, students, answer. Blood supply of the occipital lobe or the visual area. Chalo bolo, bachcho, answer this. Hey, hello, answer. It's posterior. Very good. Vaibhav, answer this. Posterior cerebral artery. Yes. Blood supply of the occipital lobe or the visual cortex is posterior cerebral plus middle cerebral artery. Remember, students, remember, yeah, MCQ aaya tha. This was an MCQ. Posterior cerebral and middle cerebral artery. You know, students, what does the middle cerebral artery supply? It supplies the macula. It supplies the macula, है ना? So the middle cerebral artery would supply the macula. So देखो, when there is thrombosis of posterior cerebral, so when there is thrombosis of posterior cerebral artery, what does a person come to you with? The person comes to you with blindness with macular sparing. Blindness with macular sparing. अगर thrombosis होता है, posterior cerebral artery का thrombosis होता है, so there is blindness with macular sparing बोलते हैं अपन उसको, because macula is supplied by whom? Middle cerebral artery. अब clear है बच्चा? Is this clear to all of you? A very important MCQ I've told you. So blood supply of the motor or the sensory area, MCA plus ACA. Blood supply of the occipital lobe or the visual area is PCA plus MCA. And what is the MCA supply? Macula. Okay, fine. Good. Chalo, very good. So we have discussed many things here. Many things. Chalo, answer this. Number 12. Coming to number 12. A 60 years old male, 60 years old patient presented with weakness of the left side of the face. Weakness of the left side of the face. Okay. There is left side of the face. If you can tell me which is the nerve involved. Students, which is the nerve involved? Yes, students, come on. Weakness of the left side of the face. The facial nerve is involved. Okay, now we know the facial nerve is involved. There is associated ipsilateral loss of pain and temperature of the face. Who carries sensations from the face? Who carries sensations from the face? This is the spinal nucleus of trigeminal nerve. Trigeminal nerve. So who's involved? The facial nerve का nucleus is involved. Left side का है ना, left side का facial nerve will be involved. Left side का spinal nucleus of the trigeminal nerve will be involved. Same side के sensations supply करते हैं face के. So spinal nucleus of trigeminal nerve. So left side का facial nerve will be involved. Left side का spinal nucleus of trigeminal nerve is going to be involved. And contralateral body. Contralateral body. Who carries sensations here from the contralateral body? That's the spinothalamic spinothalamic tract. Spinothalamic tract. Very good, very good. अब बोलो बच्चों, अब बोलो. 7 nerves involved on left side. The spinal nucleus of trigeminal nerve is involved on the left side. And the spinothalamic tract is involved. So the person gets loss of sensations on the opposite side of the body. So where is the lesion? Where is the lesion? Where is the lesion? मेड्यूला नहीं है बच्चा, सर्जरी बॉय. मेड्यूला नहीं है बच्चा. मेड्यूला में वो नहीं होता ना. मेड्यूला में 7 नर्व किधर होती है? मेड्यूला में 7 नर्व नहीं होता. इट्स नॉट मेड्यूला. वैसे 7 नर्व का न्यूक्लियस लोकेटेड. वैसे न्यूक्लियस ऑफ 7 नर्व. इट्स नॉट वॉलनबर्ग सिंड्रोम. ये वॉलनबर्ग नहीं है बच्चा. वॉलनबर्ग नहीं है. No, it's not Wallenberg's. It's in the lateral pons. Lateral pons. It's in the lateral pons. How do I know it's pons? Because the nucleus of facial nerve is located in the pons. Nucleus of facial nerve is located in the pons. I'll show you this. मैं दिखाता हूँ ये. I'll show you the slide. Look at this. Look at this slide. चलो बच्चों, you tell me what is this section taken from? What is this? This is the pons. हाँ, ये है pons. ये सेक्शन pons से लिया है. The section is taken through the pons. Now you tell me, what is this nerve? What is this nerve? This is the facial nerve. That's a facial nerve. Okay. What is this? This is the spinal nucleus of trigeminal nerve. Spinal nucleus of trigeminal nerve. So facial nerve is involved. Spinal nucleus of trigeminal nerve is involved. The spinothalamic tract is involved. So the lesion is in the lateral pons. Lateral pons. ये कौन सा nerve है? What is this nerve? Any idea? What is this nerve which is present in the pons? The nucleus is in the pons. That's the sixth nerve. Sixth nerve. And ये जो है ना, the fibers of seventh nerve, they go around the sixth nerve. देखो, the fibers of seventh nerve, they wind around the abducens nucleus and they form an elevation outside. ये elevation को क्या बोलते हो आप? What is this elevation known as? This is what we call as the facial colliculus. Facial colliculus, है ना? So how is the facial colliculus formed? The facial colliculus is formed by the fibers of facial nerve as they wind around the abducens nucleus. Bachcho, there's an MCQ which comes. There's a tumor in the floor of the fourth ventricle. Okay? There's a tumor in the floor of the fourth ventricle. The fibers of which nerves are going to be involved? The fibers of which nerves are going to be involved? Your answer is facial nerve. Tumor in the floor of the fourth ventricle is going to compress fibers of which cranial nerve? Seventh nerve. एक दूसरा MCQ है, दूसरा MCQ. Tumor in the floor of the fourth ventricle compresses the nucleus beneath the facial colliculus. बच्चों, अगर MCQ है, tumor in the floor of the fourth ventricle compresses the nucleus beneath the facial colliculus. What is that? बोलिए. देखो, अगर MCQ है, tumor in the floor of fourth ventricle compresses the facial colliculus, the fibers forming the facial colliculus. Your answer, the nerve involved is facial nerve. अगर MCQ आता है, tumor in the floor of fourth ventricle compresses the nucleus beneath the facial colliculus. Nucleus beneath the facial colliculus, then it would be the abducens nucleus. समझ में आ रहा है ना ये? हाँ, clear to all of you students? Tell me, where is this section taken from? Where is this section taken from? This is a section from the medulla. ये है section medulla का. What is this nerve which is involved? That's the 12th cranial nerve. हाँ, ये 12th cranial nerve involved है. What is this? ये क्या होता है? What is this structure? That's the medial lemniscus. And what is this? Corticospinal tracts. मतलब 3 things are involved here. एक है hypoglossal nerve is involved, the medial lemniscus is involved, and the corticospinal tracts are involved. What is this syndrome known as? Any idea what is this syndrome known as? Students, can you answer this? This is what we call as the medial medullary syndrome. Medial medullary syndrome. Okay, medial medullary syndrome. So what are the structures involved? The hypoglossal nerve is involved. So there is ipsilateral paralysis of the face, ipsilateral paralysis of the tongue, paralysis of tongue. Okay, so the hypoglossal nerve is involved, so that's ipsilateral paralysis of the tongue. The tongue is deviated to which side? The tongue is deviated to which side? The opposite side. Opposite side because of genioglossus. Genioglossus pulls the tongue to the opposite side. ठीक है, so medial medullary syndrome, which nerve is involved? Hypoglossal nerve involved होती है. So there is paralysis of tongue, same side the tongue का paralysis होता है. So the tongue is deviated to opposite side. दूसरा क्या involved होता है? Medial lemniscus. Okay, medial lemniscus involved होता है. So there is contralateral loss of fine sensation. Okay, contralateral loss of fine sensations. ठीक है, contralateral medial lemniscus carries, ये क्या carry करता है? Fine sensation. So medial lemniscus involved होता है, so contralateral loss of fine sensation and corticospinal tracts involved होते हैं. So corticospinal tracts involved होता है तो contralateral hemiplegia होता है. Hemiplegia, contralateral hemiplegia. ठीक है. So how does a person, कैसे आता है? Person comes to you, the person will have, वो person क्या complain करेगा? The person will have paralysis of tongue, say on the right side. Suppose tongue right side पे paralyzed होता है, body is paralyzed on the left side, body का paralysis left side पे होता है, fine sensations are lost on the left side. What is this syndrome known as? इसको हम बोलते हैं medial medullary syndrome. Medial medullary syndrome, this is also known as alternating hypoglossal hemiplegia. इसका दूसरा नाम है, हाँ, deviation of tongue, सुखबीर बोलता हूं, I'll tell you. इसका नाम है alternating hypoglossal hemiplegia. Alternating hypoglossal hemiplegia. Okay. Alternating hypoglossal hemiplegia. Perfect, students. Look, what is the action of genioglossus? Genioglossus को क्या बोलते हैं? Genioglossus is known as, Sukhbir, I'm telling you, genioglossus is known as the safety muscle of the tongue. Safety muscle of the tongue is genioglossus. Safety muscle of the tongue is genioglossus. Tongue is not deviated to the side of paralysis, बच्चा. देखो, safety muscle of the tongue is genioglossus. Why? It protrudes the tongue. It protrudes the tongue to opposite side. Okay, genioglossus का action क्या है? देखो, genioglossus का action is it protrudes the tongue to the opposite side. Now you tell me, अगर right side का paralysis हो गया, right hypoglossal nerve injure हो गया, right hypoglossal nerve is injured, so right genioglossus paralyze हो गया. Right genioglossus जैसे paralyze होता है, which genioglossus becomes powerful? The left becomes powerful, and the left will deviate the tongue to the right side. Okay, the tongue is deviated to the same side of lesion. Okay, the genioglossus pulls the tongue to the opposite side. Yes, Sukhbir. The tongue is deviated to the same side of lesion. Right. So, genioglossus is known as the safety muscle of the tongue. It protrudes the tongue to the opposite side. So, if there's a lesion of right hypoglossal nerve, अगर right hypoglossal nerve injury हो गया, right genioglossus paralyze हो गया, the left becomes powerful and the left will deviate the tongue to the right side. So, in lesions of hypoglossal nerve, tongue is deviated to same side of lesion. ठीक है अब? Okay, thank you, Sukhbir. Tongue is deviated to the same side of lesion. I hope this is clear. Very good. Medicos, I was going to ask you this, which is the safety muscle of the larynx. The safety muscle of the larynx is the posterior cricothyroid nahi hai bacha. It's not cricothyroid. It's the posterior cricoarytenoid. Posterior cricoarytenoid. Safety muscle of the larynx. Safety muscle of the larynx is posterior cricoarytenoid. Posterior cricoarytenoid. ठीक है? Yes, yes, yes. Tongue is deviated to the same side. Yes, Sukhbir. Correct, correct. So safety muscle of the larynx is posterior cricoarytenoid. What is the action of posterior cricoarytenoid? It is an abductor of the vocal cords. It's an abductor of the vocal cords. So it is known as the safety muscle of the larynx. Clear to all of you students? Clear? Okay, fine. Very good. Very good. Very good. Very good. Chalo. So what is the answer for this? Chalo, you're all nice. Your preparation is all very good. So I hope I'm giving a good final touch. Okay, it's a quick revision just before the exam. It's a last minute revision. So answer is lateral pons. Lateral pons. Okay. Chalo, identify this structure. Number 13. Students, identify this pointed structure. Any guesses here? Yeah, difficult hai. This is a difficult MCQ and this is a very important MCQ, bacha. This is a very important MCQ. Any guesses? What is this pointed structure? Yes, any guesses? What is this pointed structure? Safety muscle of the oropharynx. Safety muscle of the oropharynx. Safety muscle of the vocal cords है. Safety muscle of the tongue है. Safety muscle of the oropharynx. Okay. Chalo, answer this MCQ. What is this? What is this vein? Any guesses? Basal vein नहीं है ये. This is a difficult MCQ. This is a section of the brain. ये section लिया brain का. I'll just tell you. Answer is internal cerebral vein. The answer for this is internal cerebral vein. See, I'll just label this for you. This is number 1. Number 1. This is number 2. Number 2. And this is number 3. This is number 3. Chalo, if you can answer this. Ye kaun hai? Who's number 1? What is this red one? Red is choroid plexus. ये है choroid plexus. ये जो red आप देख रहे हो, that's a choroid plexus. So number 2 is the choroidal vein. Choroidal vein. ये जो number 2 है, that's a choroidal vein. Number 1 is the thalamostriate vein. Thalamostriate vein. Okay, just remember this. ये सब बहुत important MCQs है. This is the thalamostriate vein. Okay. So number 1 is the thalamostriate vein. Number 2 is the choroidal vein. And number 3 is the septal vein. Septal vein. Septal vein comes from the septum pellucidum. Okay. So septal vein drains the septum pellucidum. The thalamostriate vein is between the thalamus and the caudate nucleus. Thalamus and caudate nucleus के बीच में होता है ये thalamostriate vein. And there's a vein which drains the choroid plexus. इसे हम बोलेंगे choroidal vein. Together, these 3 will join to form the internal cerebral vein. इसका नाम है internal cerebral vein. Internal cerebral vein. Okay. And 2 internal cerebral vein joins to form. 2 internal cerebral vein joins to form. ये क्या है? This is the great cerebral vein. This is the great cerebral vein of Galen. That's a great cerebral vein of Galen. Clear, students? थोड़ा सा डिफिकल्ट है ये. This is a difficult MCQ, but this is a very important MCQ. I'll write this for you. I'll write this for you. ये पहले समझ लो. So which are the veins here? Okay, I'll write this for you. Understand this. Thalamostride vein plus choroidal vein, thalamostride vein plus choroidal vein plus septal vein joins to form the internal cerebral vein. In short, I'm telling you this, okay? Internal cerebral vein. Two internal cerebral vein joins to form the great cerebral vein. Two internal cerebral vein joins to form the great cerebral vein of Galen, and this great cerebral vein drains into. Any guesses? It drains into what? Vaishnavi, what happened? देखो, thalamostride vein, choroidal vein. Thalamostride is present between the thalamus and the caudate nucleus. The choroidal veins, ये क्या drain करेगा? Choroid plexus. And the septal vein, ये क्या drain करेगा? The septum pellucidum. ये तीनों veins are going to join to form the internal cerebral vein. अब दो internal cerebral vein है, one on this side, one on this side. Both the internal cerebral vein joins to form the great cerebral vein of Galen. And this great cerebral vein of Galen drains into what? Chalo, answer this. Straight sinus. Internal jugular nahi, drains into straight sinus. Venous drainage of the brain है. Venous drainage of the brain. This is a very important MCQ. बच्चों, this is a very important MCQ. Venous drainage of the brain. ठीक है? Okay. एक और vein है. This one more vein. Have a look at this. Look at this. Which is this surface of the brain? कोई बोल सकता है? ये कौन सा surface है brain का? हाँ, very good. What is this surface? I'll just label this as number 1. This as number 2. And this as number 3. Okay, this is number 3. So number 1, number 2, and number 3. That's the inferior surface of the brain. I hope everyone is understanding this. ये inferior surface देख रहे हो brain का. So number 1 is anterior cerebral vein. See, in a very easy way, I'm telling you. In a very easy way. Anterior cerebral vein. 2 is the deep middle cerebral vein. And the third one is the striate vein. Okay, the third one is the striate vein. Together, these 3 are going to join to form, ये तीनों क्या बनाते हैं? They together forms the basal vein. And this basal vein drains into the great cerebral vein. Drains into the great cerebral vein. I hope this is clear to all of you. I'll make a very easy slide for you. बट ये आना चाहिए. This you should know. हाँ, ये सब आना चाहिए आपको. ये बहुत MCQs में आते हैं. I'll make a slide for you. You're following, all of you? Yes, बच्चों, clear है? I'll make a slide for you. देखो, this is an easy way of representation. हाँ, ये septal, ये thalamostride, and ये choroidal together joins to form a vein. ये septal, ये thalamostride, and ये choroidal together joins to form a vein. And this drains into great cerebral vein of Galen. 3 veins here would join to form a vein which drains into the great cerebral vein. बस ये याद रखना, ये slide, everything will be done. हाँ, बस ये स्लाइड याद रखना. That's a septal vein, thalamostriate vein, thalamostriate, septal, and ये choroidal. This is internal cerebral vein. Internal cerebral vein joins to form great cerebral vein of Galen. ये सबसे easy way है. This is the easiest way to understand things. Easiest way to understand things. What is this? This is the anterior cerebral vein. This is the deep middle cerebral, and this is the septal vein, joins to form basal vein. That's it. So I hope this is clear to all of you. So make it easy. ऐसे ना flow charts बनाइए. Make flow charts. And this would be, what is this going to be? Straight sinus. Fine. I hope this is clear to all of you. Perfect. Satisfied? Happy? This is a very difficult topic, students. I made it very easy for you. Okay. Okay, very good. Chalo, we'll go to the next MCQ now. Perfect, crystal clear. Okay. Clear, students? We'll proceed. Number 14. Come on, number 14. A 65 years old lady presents with slurred speech. Slurred speech. On examination. Okay, very good, very good. चलो, good. सबको समझ में आ रहा है? ये बहुत easy way है representation का. Okay, very good. On examination, cerebrovascular accident was suspected involving the inferior frontal gyrus. बच्चों inferior frontal gyrus पे बहुत MCQs आए, बहुत. So which area, ये कौन सा area होता है in the inferior frontal gyrus? Any guesses? 44-45. 44-45 is Broca's area. है ना? 44-45 is Broca's area. Which functional area would be affected? That's the Broca's area. Broca's area, that's the functional area. Okay, quickly just tell me this. Again, quickly I'll just draw this for you. Okay, students, what is this sulcus? That's a lateral sulcus. What is this sulcus? Central sulcus. That's the precentral sulcus. ये होगा postcentral sulcus. Postcentral sulcus. ठीक है? ये frontal lobe है. ये frontal lobe है, तो ये है superior frontal sulcus and inferior frontal sulcus. ये temporal lobe है, so ये है superior temporal sulcus, inferior temporal sulcus. ये parietal lobe है, ये occipital lobe है. So what is this sulcus known as? Parieto-occipital sulcus. And that's the calcarine sulcus. ये होगा calcarine sulcus. So now you tell me, what is this area? This is area number 312. 312. 312 is known as primary sensory area. Only the main things I'm telling you. Any of the main things. 312 is primary sensory area. अब ये 5-7 क्या होगा? 5-7 हर एक एरिया के, I mean हर एक it has got two types functional areas, or out of two types. दो types के होते हैं. एक होता है primary area, एक होता है association area. So 312 क्या है? 312 is the primary sensory area. What is this 5-7? ये 5 और 7 क्या होता है? 5-7 is the sensory association area. Sensory association area. Yes, ये सब recordings मिलेंगे बच्चों. You'll get everything. Just concentrate, huh? ठीक है, वेरी गुड वेरी गुड. सो 312 इज द प्राइमरी सेंसरी एरिया. ये 57 क्या होता है? 57 इज द सेंसरी एसोसिएशन एरिया. अब बोलो बच्चों, व्हाट इज दिस एरिया नंबर 17? 17 is the primary visual area and 18 and 19 क्या होते हैं? 18 and 19 are visual association areas, है ना? 18 19 होता है visual association areas. Tell me बच्चों, what is this 41 42? 41 42 is primary auditory area. Primary auditory area is 41 42. बच्चों, what is this number 22? If anyone can tell me, ये 22 क्या होता है? What is this 22? 22 is known as the Wernicke's area. Yes, very good. 22 is known as Wernicke's area, and 44 45 is Broca's area. Broca's area. Broca's area is also known as the motor speech area. Motor speech area, and Wernicke's area is known as the sensory speech area. Sensory speech area. Very nice. So sensory speech area is Wernicke's area 22. 44 45 is Broca's area. And ये क्या है? Students, what is this? Can anyone tell me? This is an association fiber which connects the Wernicke's and the Broca's areas. What is that? What is that fiber known as? The uncinate fasciculus. Uncinate fasciculus, right? Uncinate fasciculus. Some books mention, yes, Sagar, some books mention 39 40, some books mention 22 also. Some books mention 39 40 as a higher association area, higher association. Fine. Okay. What is this area number 4? Area number 4 is primary motor area. Primary motor. 6 and 8 are known as premotor areas. Premotor areas. And 9, 10, 11, 12. 9, 10, 11 and 12 are known as prefrontal areas. Prefrontal areas. Yes, 9, 10. Sagar, there's a, there's a controversy. There's a difference of opinion. Some books mention 22 as Wernicke's area. Some books mention 39, 40 as Wernicke's area. जैसे ऑप्शन होगा वैसे देख के आंसर करना है. ठीक है? So area number 4 is primary motor. Area number 6 and 8 इसे आप बोलोगे premotor area, and 9, 10, 11, 12 are known as prefrontal areas. Prefrontal areas. Pradyuman, this will be there in the notes. हाँ, notes में होगा ये. ठीक है? Clear to all of you? Just remember this important things. So 41 42 is primary auditory area. 17 is primary visual area. 44 45 is Broca's area. And 312 is primary sensory area. ठीक है? Okay, clear to all of you? So okay, very good students, very nice. Good going. Radhika, just wait. Let me finish this, then we'll answer your queries. Okay, perfect. Come to the next MCQ. Here we go, students. A 44-year-old man comes to a hospital with abdominal pain, jaundice, loss of appetite, and weight gain. On examination of his radiographs and CT scan, a physician finds a slowly growing tumor in the uncinate process of pancreas. Which of the following structures is most likely to be compressed? Yes. Session is still 9:45. 9:45. Prarup. 9:45 तक है session. चलो, answer this, students. Answer this. What is the answer for this? Come on, students, come on. So which is a structure present over the uncinate process? If there's a tumor of the uncinate process of pancreas, which is the structure compressed? Answer is the superior mesenteric artery. Superior mesenteric artery. Very good. Answer is superior mesenteric artery. A very important MCQ, students. Very important MCQ. Blood vessels related to the pancreas. Okay. Okay. D नहीं है बच्चा. Answer is C. Answer is C बच्चा. Superior mesenteric artery. Answer is C. I'll just tell you this. ये देखिए. Blood vessels related to the pancreas. Huh? A very important MCQ. Blood vessels related to the pancreas. Avesh. Okay. All videos will be there for you. So what is this artery on the superior border of the body of the pancreas? That's a splenic artery. Splenic artery. So the artery which is present on the superior border of the body of the pancreas is the splenic artery. Yes, very good. What is this vein present behind the body of the pancreas? Students, any guesses? What is this vein behind the body of the pancreas? That's a splenic vein. Splenic vein. The vein which is present on the uncinate process of the pancreas is the superior mesenteric vein, and the vein formed behind the neck of the pancreas. What is this vein? That's the portal vein. Portal vein. Okay. I'll just draw this for you. This is the duodenum. Duodenum. So this is very important, very important. So superior border of the body. Superior border of the body of the pancreas is splenic artery. Splenic artery. Behind the body of the pancreas is the splenic vein. Splenic vein. Hey, just wait. Let me finish this. Then on the uncinate process, कौन होता है? That's the superior mesenteric vessels. Superior mesenteric vessels. And behind the neck of the pancreas, यहाँ पे दो vessels होते हैं. Behind the neck of the pancreas, there are two vessels here. In the lower part, and in the upper part. In the lower part and in the upper part. In the upper part is the portal vein. In the upper part is the portal vein. And in the lower part is the superior mesenteric vein. Okay, clear as superior mesenteric vein. See, superior mesenteric vein first, pehle, it is present on what? Uncinate process, है ना? It is first present on the uncinate process and then it goes behind the neck of the pancreas. So पहले वो uncinate process पे होता है, फिर ये जाता है behind the neck of the pancreas and it joins with the splenic vein to form the portal vein. Clear, students? Clear to all of you? Yes, Yashashvi, clear? Clear, Shifana? Okay. So on the superior border of the body is the splenic artery. Behind the body is the splenic vein. On the uncinate process is the superior mesenteric vessels. And behind the neck of the pancreas, in the lower part is the superior mesenteric vein. And in the upper part is the portal vein. Perfect. Clear to all of you? Okay. So just remember this. Splenic artery is clear to you? Splenic artery is a branch of what? Pharyngeal arches explain किया ना बच्चा. Pharyngeal arches we have explained. Arvind, pharyngeal arches explain किया हमने. Just go through the session later. Splenic artery is a branch of celiac trunk, है ना? It's a branch of celiac trunk. Celiac trunk. Portal vein is clear. Portal vein. How is the portal vein formed? By the joining of the splenic vein with the superior mesenteric vein. Superior pancreaticoduodenal artery, it's a branch of, yes, any idea? Branch of superior pancreaticoduodenal artery is a branch of gastroduodenal artery. It's a branch of gastroduodenal artery. Okay, so superior pancreaticoduodenal artery is a branch of gastroduodenal artery, which is a branch of common hepatic artery. Branch of common hepatic artery. Duodenum. Kuldeep, I'll revise this. Kuldeep. Okay. Okay, just quickly we'll go through this. Chalo, bacho, quickly you tell me this. Celiac trunk. Answer this fast. Celiac trunk. Celiac trunk gives three main branches. Celiac trunk के तीन main branches होते हैं. What is that? Splenic, common hepatic, and the third one is left gastric. Left gastric, splenic, and common hepatic. Yes, Kuldeep, I'm revising. Splenic, left gastric, and common hepatic. Common hepatic gives further three branches. One is the right gastric. Second is the gastroduodenal, and the third one is the hepatic artery proper. ठीक है. Gastroduodenal gives two branches. One is the superior pancreaticoduodenal artery, and the other one is the right gastroepiploic. Okay, that's it. Clear to all of you? Internal capsule देखते हैं. I'll explain you. Okay, duodenum बोल सकते हो जल्दी. Duodenum, can you tell me quickly? See, duodenum has got four parts. जल्दी बोलो. Duodenum is a very important topic. Duodenum के चार parts है. First, second, third, and that's the fourth part of the duodenum. Fourth part. What is the length of the first part of the duodenum? 5 centimeters. What is the length of the second part of the duodenum? Second part, 7.5 centimeters. What is the length of third part of the duodenum? Third part, 10 centimeters. And what is the length of fourth part? 2.5 centimeters. ठीक है? So first part is 5 centimeters long, second part is 7.5 centimeters, third part is 10 centimeters, and the fourth part is 2.5 centimeters. That's duodenum. The entire duodenum is retroperitoneal. Okay, entire duodenum retroperitoneal होता है, except a small area of the first part. Students, the entire duodenum is retroperitoneal except a small area of the first part, and a small area of the fourth part is intraperitoneal. ठीक है? A small area of the first part and a small area of the fourth part is intraperitoneal. Perfect. Okay, so what are the relations of the first part of the duodenum? कोई बोल सकता है first part of duodenum का relations बोलिए? Anyone? Come on, quickly you answer. First part of the duodenum का anterior relation क्या है? Students, first part of the duodenum का anterior relation is the neck of the gallbladder. एक short में explain करता हूँ. First part of the duodenum का anterior relation is the neck of the gallbladder. The fundus of the gallbladder is related to the transverse colon. The first part, anterior relation, is the neck of the gallbladder. Posterior relation of the first part क्या होता है? Any guesses? Portal vein, then the gastroduodenal artery. What else? Students, what else? Bile duct. ठीक है? This is very important. Quadrate lobe बोल सकते हो. Yes, quadrate lobe भी बोल सकते हो. Neck of the gallbladder. So the first part का anterior relation, very important, neck of the gallbladder. Posterior relation of the first part, one, the bile duct, the gastroduodenal artery, and the portal vein. Now, students, which part of the duodenum is more prone to ulcer? Ulcers are common in the first part of the duodenum on the posterior wall. है ना, posterior wall of the first part, ulcers are very common. So अगर ulcer है first part of the duodenum के posterior wall पे अगर ulcer है, it is going to erode which artery? A very very important MCQ, हमेशा पूछते हैं. Ulcer, yes, wait. Ulcer on the first part of the duodenum on the posterior wall is going to erode which artery? That's the gastroduodenal artery. ठीक है? Fine, clear with the first part. Second part के relations देखिए. Second part का anterior relation. Who's going to cross this second part like this? The transverse colon. है ना? Second part का anterior relation is the transverse colon. And second part ka posterior relation is going to be what? What is this kidney? What is this kidney? The right kidney. That's the right kidney. So second part, anterior relation, transverse colon. Second part ka posterior relation is the right kidney. Perfect. Easy. Come to the third part. Third part, anterior relation. Just in short, I'm telling you, third part ka anterior relation is an artery. Any idea what is this artery here? Which crosses the third part of the duodenum. And the third part of the duodenum lies between this artery and the aorta. And the third part of the duodenum is compressed between this artery and the aorta. Which is that artery? Third part of the duodenum. Just the important points I'm telling you. Hey, just wait. Let me finish the important topics. Just wait. Okay, answer this. Just concentrate on what I'm telling. So the third part of the duodenum in front is crossed by the superior mesenteric artery, and the root of mesentery. The superior mesenteric artery and the root of mesentery crosses the third part of the duodenum in front, and the third part of the duodenum gets compressed between the superior mesenteric artery and the aorta, and this is what we call as the SMA syndrome. Or that is also known as the Wilkie's syndrome. SMA syndrome or the Wilkie's syndrome. That's a compression of the third part of the duodenum between the superior mesenteric artery and the aorta. That's Wilkie's syndrome or the superior mesenteric artery syndrome. Third part of the duodenum का posterior relation क्या होगा? Posterior relation of the third part of the duodenum. Yes, any guesses? Third part of the duodenum का posterior relation would be aorta, IVC, the right psoas major, and the right ureter. I'm not drawing that. Posterior relations of the third part. Posterior relations of the third part of the duodenum. Abdominal aorta. Okay, it is something like this. See here, ये aorta, that's the IVC. That's the aorta here. Aorta with the origin of superior mesenteric artery. Okay, then this is the right psoas major, and on the psoas major क्या होता है? What lies on the psoas major is the ureter. So this becomes the anterior relations of the third part of duodenum. This becomes the posterior relations of the third part of duodenum. Am I clear to all of you? Is this clear to all of you? लोअर लिम्ब भी पढ़ा रहा हूँ एक MCQ सबसे लिया है. I've taken MCQs from all the topics. ठीक है students? So third part, anterior relation is the superior mesenteric artery with the root of mesentery. The posterior relations of the third part is the aorta, the IVC, the right psoas major, and the right ureter. That completes my duodenum. Third part. Fourth part, there's nothing specific. Okay, I hope this is clear to all of you students. Chalo, coming to this. Number 16. A 25 years old male comes to the physician because of intermittent groin pains. He is a construction worker and says that the pain gets worse on lifting heavy weights and after a long day of working. Physical examination shows a bulge above the inguinal ligament. It's a bulge above the inguinal ligament. A bulge above the inguinal ligament would, you would think of what? An inguinal hernia. A bulge below the inguinal ligament would be suggestive of femoral hernia. Femoral hernia, yes. The bulge increases in size when he bends down. A groin USG reveals that a mass originates medial to the inferior epigastric vessels. So what is this, students? This is a hernia. Hernia. The patient's condition is most likely caused by which of the following? Come on, answer this. 10:45 तक है session. 10:45. So what is the answer for this, students? What is the answer for this? That's inguinal hernia. So what is the answer for this? It's what inguinal hernia is that? No, Yashdev, that is not C. C nahi hai answer. Answer is not C, bacha. Okay, just one moment. Quickly tell me. This is the rectus abdominis. That's the pubic symphysis. Rectus abdominis, pubic symphysis. That's the inguinal ligament. Inguinal ligament. What is this artery here? What is this artery here? This is the inferior. Okay, I'll draw it on this side. That's the inguinal ligament. ये artery का नाम क्या है? That's the inferior epigastric artery. ठीक है ना? This is the inferior epigastric artery. चलो बच्चों, tell me what is this triangle here? So this is the rectus abdominis muscle. That's the inguinal ligament. That's the inferior epigastric artery. This becomes the Hasselbalch's triangle. Hasselbalch's triangle, right? So where is this? This is the deep inguinal ring. That's the deep inguinal ring. Sorry. One moment. Okay. Clear, students? So what is this hernia known as? This is a indirect. This is a direct inguinal hernia. The hernia which comes out through the Hasselbalch's triangle is known as a direct inguinal hernia. And this Hasselbalch's triangle is further divided into two parts. Can anyone tell me what is this known as? This is known as the obliterated umbilical artery. Obliterated umbilical artery, or this is what we call as the medial umbilical ligament. Medial umbilical ligament. See, if a hernia comes through the Hasselbalch's triangle, what is that hernia known as? This hernia is known as a direct inguinal hernia. If a hernia comes lateral to the inferior epigastric artery, what is that hernia known as? Indirect inguinal hernia. An indirect inguinal hernia is generally due to persistent processus vaginalis. It is due to persistent processus vaginalis. A direct inguinal hernia is generally due to breakdown of the fascia transversalis. Fascia transversalis का breakdown होता है. The hernia which occurs is a direct inguinal hernia. Direct inguinal hernia. If a hernia occurs here, student, if a hernia occurs here, this is what we call as a lateral direct inguinal hernia, lateral direct. And if a hernia comes medial to the obliterated umbilical artery, this is what we call as a medial direct inguinal hernia. ये clear है, students? Are you able to follow this, students? Students, are you able to follow this? So what are the boundaries of Hasselbalch's triangle? What are the boundaries of okay, I'll magnify this. So this is the rectus abdominis. This is the rectus abdominis. That's the inferior epigastric artery. That's the inferior epigastric artery. ये है inguinal ligament. So rectus abdominis, inferior epigastric artery and the inguinal ligament. ये जो triangle बनता है इसका नाम है Hasselbalch's triangle. अगर hernia Hasselbalch's triangle से आता है, if a hernia gets out from here, it is known as a direct inguinal hernia. ये जो Hasselbalch's triangle है इसके further दो parts होते हैं. There are two parts of the Hasselbalch's triangle, and who divides this Hasselbalch's triangle? That's the obliterated umbilical artery, or this is what we call as the medial umbilical ligament. अगर hernia यहाँ से आएगा, it is known as a lateral direct. अगर hernia यहाँ से आया, it is known as a medial direct inguinal hernia. A direct inguinal hernia is due to breakdown of fascia transversalis, and an indirect inguinal hernia is generally due to persistent processus vaginalis. Perfect. Clear to all of you students? Okay. So answer is A for this. Answer is A. Persistent processus vaginalis will lead to indirect inguinal hernia. Indirect inguinal hernia. Weakness of rectus abdominis. Then you get this, incisional hernia वगैरह होता है. अगर rectus abdominis weak है तो incisional hernia होता है. Okay, widening of femoral ring. Tell me बच्चों, femoral ring is very important. हाँ, femoral ring एक important topic है. I'll just tell you this femoral ring. Tell me how is the femoral sheath formed? Femoral sheath. ये femoral sheath है. Femoral sheath कैसे बनता है? Femoral sheath anteriorly is formed by, एक मिनट, femoral, I'll just tell you this. Femoral sheath, a very important MCQ, is formed by two layers. Anteriorly is the fascia transversalis. Anteriorly is the fascia transversalis. Posteriorly is the fascia iliaca. Just remember this, students. आगे fascia transversalis होता है, पीछे fascia iliaca होता है. अब ये जो बन गया, that is known as the femoral sheath. ये femoral sheath के तीन compartments होते हैं. तीन compartments. One is a lateral compartment, one is an intermediate compartment, and एक होता है medial compartment. Lateral, intermediate, medial. So what is present in the lateral compartment? Any guesses? Students, femoral sheath, lateral compartment में क्या होता है? Lateral compartment में होती है femoral artery and the femoral branch of genitofemoral nerve. So lateral compartment में होता है femoral artery and the femoral branch of genitofemoral nerve. Intermediate compartment में होता है femoral vein, and जो medial compartment है, that is known as the femoral canal, है ना? ये है femoral canal. The upper part of femoral canal, ये जो upper part है femoral canal का, what is this known as? चलो बच्चों बोलो, this is a very important MCQ. The upper part of femoral canal is known as, yes students, what is this? The upper part of femoral canal, इसको हम बोलेंगे femoral ring. Okay, what are the boundaries of femoral ring? इसे मैं label करता हूँ 1, 2, 3 and 4. हाँ, boundaries of femoral ring. So what is 1? Boundaries of femoral ring. 1 is, चलो बोलो बच्चों, 1 anteriorly is inguinal ligament. So anterior is number 1. वो boundary कौन बनाता है? Inguinal ligament. Inguinal ligament is also known as Popard's ligament. Number 2 is the medial boundary. Medial कौन बनाता है? Lacunar ligament. Lacunar ligament is also known as Gimbernat's ligament. Lacunar ligament का दूसरा नाम है Gimbernat's ligament. नंबर 3 क्या होगा? Posterior. Posterior क्या होता है? Posterior is the pectinate ligament. पेक्टिनेट लिगामेंट, इसका दूसरा नाम है कूपर्स लिगामेंट, कूपर्स लिगामेंट। एंड फोर्थ इज लैटरल, लैटरल, ये बहुत इंपॉर्टेंट एमसीक्यू है स्टूडेंट्स, दिस इज अ वेरी इंपॉर्टेंट एमसीक्यू। लैटरली is the septum separating it from, septum separating it from femoral vein, femoral vein। ठीक है स्टूडेंट्स, इज दिस क्लियर टू ऑल ऑफ यू? सो बाउंड्रीज ऑफ femoral ring क्लियर है। आगे इंग्वाइनल लिगामेंट, इंग्वाइनल लिगामेंट का दूसरा नाम है पोपार्ट्स लिगामेंट। मीडियली इज द लैक्यूनर लिगामेंट, ऑल्सो नोन एज द गिम्बर्नैट्स लिगामेंट। posteriorly is the pectinate ligament, उसका दूसरा नाम है Cooper's ligament, and laterally is the septum separating it from femoral vein। Perfect। अब यहां पे एक lymph node होता है। any guesses ये lymph node का नाम क्या है? ये lymph node का नाम क्या है? What is this lymph node known as? That is known as the lymph node of Cloquet। The femoral ring is closed by lymph node of Cloquet or Rosenmuller, Rosenmuller। And what is this lymph node drain? ये क्या drain करता है? What is this lymph node drain? It drains the glans penis and the glans clitoris, glans penis and the glans clitoris। Okay, so the deep inguinal lymph node that lies over the femoral ring, and that deep inguinal lymph node is known as the lymph node of Cloquet। And what is it going to drain? The glans penis and the glans clitoris। बच्चों अगर MCQ आता है, the penis and the clitoris drains into, your answer superficial inguinal lymph nodes। remember students, penis and clitoris drains into, your answer is going to be the superficial inguinal lymph nodes। अगर MCQ आता है glans penis and glans clitoris drains into, your answer would be the lymph node of Cloquet। That's a deep inguinal lymph node, deep inguinal lymph node। Perfect students, is this clear to all of you? I've explained you everything about the femoral hernia। So अगर femoral hernia होता है, femoral hernia होता है, you have to cut, you have to dilate the femoral ring। So क्या cut करते हो आप? ये कौन सा boundary cut करते हो? Which boundary of the femoral ring do we cut? We cut the lacunar ligament। We cut the lacunar ligament, we dilate the femoral ring, we push the hernia up। ठीक है? But sometimes there is an artery present over the lacunar ligament। Any guesses? ये artery कौन सी होती है? Which is the artery present over the lacunar ligament? Occasionally, sometimes there's an artery present over the lacunar ligament। Fossa is a depression, बच्चा। Fossa is a depression। Okay. Yes, tell me। So when you cut the lacunar ligament, there's an artery there। उसका नाम है inferior, no, that is known as the abnormal obturator artery। And if you cut this abnormal obturator artery, it would lead to hemorrhage। Okay, so lacunar ligament पे occasionally क्या होता है? Abnormal obturator artery, and if we cut this artery, it would lead to hemorrhage। Perfect, perfect। I've told you everything here। चलो बच्चों, answer this now। Number 17, which of this ligament develops from the pointed structure? Yes, what is this pointed structure? Any guesses? This is the ventral mesogastrium। ये stomach है ना? This is the stomach। हाँ, ये आप देख रहे हो? That is the stomach। And what is all this? ये क्या होता है ऐसे? This is going to be the ventral mesogastrium, ventral mesogastrium। And what is this going to be? This is going to be the dorsal mesogastrium। डॉर्सल एंड वेंट्रल मीसोगैस्ट्रियम, ठीक है स्टूडेंट्स. सो व्हाट डेवलप्स इन द वेंट्रल मीसोगैस्ट्रियम? ये वेंट्रल मीसोगैस्ट्रियम में क्या फॉर्म होता है? इन द वेंट्रल मीसोगैस्ट्रियम द लीवर इज फॉर्म्ड. ये देखो द लीवर ग्रोज इन द वेंट्रल मीसोगैस्ट्रियम. एंड जैसे ये लीवर वेंट्रल मीसोगैस्ट्रियम में फॉर्म होता है, द वेंट्रल मीसोगैस्ट्रियम गेट्स डिवाइडेड इनटू टू पार्ट्स. इसके दो पार्ट्स बनते हैं. दिस इज व्हाट वी कॉल एज द falciform ligament, and this is what we call as the liver से stomach तक. What is this known as? Lesser omentum. So what are the structures which develop from the ventral mesogastrium? The falciform ligament, the lesser omentum, ठीक है, develops from the ventral mesogastrium. Anything else develops from the ventral mesogastrium? Okay, I'll just write this down for you. This is a very important MCQ. Structures derived from ventral mesogastrium. Structures derived from the ventral mesogastrium. One is the falciform ligament. ये बहुत important MCQ है. Second is the lesser omentum. Then the superior and inferior layers of coronary ligament. Superior and inferior layers of coronary ligament. See, liver है ना, liver develops in what? Liver develops in the ventral mesogastrium, है ना. जो liver है ना, liver ventral mesogastrium के अंदर बनता है. So all the ligaments of liver would be derived from ventral mesogastrium. All the ligaments of liver. So which are the ligaments of liver? The superior and the inferior layers of coronary ligament, the right and the left triangular ligaments. The right and the left triangular ligaments. ठीक है? So what is derived from the ventral mesogastrium? Students, this is a very important MCQ. Ventral mesogastrium से क्या बनता है? One, the liver grows in the ventral mesogastrium. It divides the ventral mesogastrium. दो parts में divide करता है ये. One, from the anterior abdominal wall to the liver, इसे हम बोलते हैं falciform ligament. From the liver to the stomach, this is known as the lesser omentum. And because the liver, ये liver ventral mesogastrium में grow होता है, तो जितने भी ligaments है liver के, these are derived from ventral mesogastrium. ठीक है? Now, who develops in the dorsal mesogastrium? Dorsal mesogastrium में क्या form होता है? Spleen form होता है. Okay? So, dorsal mesogastrium, what develops is gastrosplenic ligament. From the stomach to the spleen, linorenal ligament, gastrosplenic ligament, rhinorenal ligament, phrenicocholic ligament, and the gastrophrenic ligament. So just remember this, students. Is this clear? So what develops from the dorsal mesogastrium? One is the gastrosplenic ligament, second is the linorenal ligament, third is the phrenicocholic ligament and gastrophrenic ligament. Septum transversum develops from ventral mesogastrium. Yes, ventral mesogastrium. ठीक है? So these are the derivatives of ventral and dorsal mesogastrium. ये याद रखिए students. Okay. Chalo, number 18. Come on, students. We're coming to an end of it. Answer this. Identify the pointed structure. Come on. I've written many things now. Now you answer. What is this pointed muscle? Any guesses for this pointed structure? Any guesses? What is this pointed muscle? This is the, yes, any guesses? What is this pointed structure? This is the brachioradialis. Answer is brachioradialis. What is this nerve, students? What is this nerve? That's the radial nerve. What is this branch of radial nerve? Hepatoduodenal, gastroduodenal. Same है, lesser omentum है वो, lesser omentum. लेसोमेंटम लिखा है ना, लेसोमेंटम। लेसोमेंटम के दो पार्ट्स होते हैं ना, वन इज गैस्ट्रो, वही है वो लेसोमेंटम, ठीक है। सो दैट्स ब्रेकियोरेडियलिस। व्हाट इज दिस नर्व? दैट्स द सुपरफिशियल ब्रांच ऑफ रेडियल नर्व, सुपरफिशियल ब्रांच ऑफ रेडियल नर्व। स्टूडेंट्स ये बहुत इंपॉर्टेंट स्लाइड है। व्हाट इज दिस नर्व? कैन एनीवन टेल मी व्हाट इज दिस नर्व? यस, व्हाट इज दिस नर्व? Come on, come on, come on, students. Answer, 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 answer. You'll get the PDF of this session on our Telegram. हाँ, इसका पूरा PDF मिल जाएगा आपको Telegram ग्रुप पे. So don't worry. This is the median nerve. Median nerve. This is the ulnar nerve. Ulnar nerve. Okay. What is this muscle? ये कौन है? What is this muscle? This is the brachialis. Brachialis. What is this muscle? That's the biceps. Biceps. What is this nerve? Students, what is this nerve? Any guesses? ये nerve कौन सी है? चलो बोलो. What is that nerve here? I'll magnify this for you. What is that nerve here? The nerve which lies between the biceps brachii and the brachialis. Any guesses? The nerve which lies between the biceps brachii and the brachialis. Yes, Vishal. Yes, yes. The nerve which lies between the biceps brachii and the brachialis, that's the musculocutaneous nerve. Musculocutaneous nerve है ये students, musculocutaneous nerve. Is this clear to all of you? So biceps brachii के नीचे होता है brachialis, biceps and brachialis के बीच में होता है ये musculocutaneous nerve, musculocutaneous nerve. Yes, Vishal, correct है बाबा, बराबर है. All these nerves are clear? What is this muscle? This muscle is the supinator. 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 Anterior intraosseous nerve is a branch of median nerve. ये याद रखना. Anterior intraosseous nerve is a branch of median nerve. The posterior intraosseous nerve is a branch of radial nerve. Anterior intraosseous nerve is a branch of median nerve. The posterior intraosseous nerve is a branch of radial nerve. The posterior intraosseous nerve pierces, if you can answer this, posterior intraosseous nerve pierces a muscle. बोलिए क्या pierce करता है? Posterior intraosseous nerve, PIN, posterior intraosseous nerve pierces the supinator. Supinator. Very good. So posterior intraosseous nerve क्या pierce करती है? Supinator. The anterior intraosseous nerve, that's a branch of median nerve. And what does it supply? Yes, students, if you can answer this. चलो बोलिए. Anterior intraosseous nerve क्या supply करता है? The anterior intraosseous nerve supplies three muscles. Three muscles. One, flexor pollicis longus. Flexor pollicis longus. Pronator quadratus. And flexor digitorum profundus. Lateral half. Just remember this, students. So posterior intraosseous nerve is a deep branch of radial nerve, and posterior intraosseous nerve क्या supply करती है? I mean, it pierces what? Supinator. The anterior intraosseous nerve is a deep branch of median nerve, and what does the anterior intraosseous nerve supply? One, the flexor pollicis longus. Second, the pronator quadratus, and third is the lateral half of flexor digitorum profundus. Perfect. Is this perfect to all of you? ये slide clear है ना? This all a very important visual slides है बच्चा. And if you can tell me what is this muscle, students, what is this muscle? Come on, answer this. What is that muscle? This is the pronator teres. Okay, that's a pronator teres. And there's a nerve which passes between the two heads of pronator teres. Name. There's a nerve which goes between the two heads of pronator teres. फोराम में था वो मीडियन नर्व. हाँ, द नर्व विच गोज बिटवीन द टू हेड्स ऑफ प्रोनेटर टीरिस इज median nerve. Very good, very good. The nerve which goes between the two heads of pronator teres is the median nerve. Median nerve. So this median nerve can get compressed between the two heads of pronator teres, and इसे हम बोलते हैं pronator teres syndrome. Pronator teres syndrome. So the nerve between the two heads of pronator teres is the median nerve, and the median nerve can get compressed between the two heads of pronator teres, that is the pronator teres syndrome. Ulnar nerve goes between the two heads of flexor carpi ulnaris, two heads of flexor carpi ulnaris, and compression is known as बोल सकते हो? यस बच्चों बोलो. अल्ना नर्व ये दो हेड्स के बीच में से जाता है. फ्लेक्सर कार्पी अल्नारिस के दो हेड्स के बीच में से कौन जाता है? अल्ना नर्व. एंड कंप्रेशन ऑफ अल्ना नर्व बिटवीन द टू हेड्स ऑफ फ्लेक्सर कार्पी अल्नारिस इज नोन एज क्यूबाइटल टनल सिंड्रोम. ठीक है स्टूडेंट्स, क्लियर? So median nerve goes between the two heads of pronator teres. The ulnar nerve goes between the two heads of flexor carpi ulnaris, and compression of this ulnar nerve between the two heads of flexor carpi ulnaris is known as cubital tunnel syndrome. Compression of median nerve in the carpal tunnel. Students, compression of median nerve in the carpal tunnel is known as carpal tunnel syndrome. That's carpal tunnel syndrome. Okay, very good, very good. Chalo students, if you can answer this. Number 19, a 34 years computer operator complains of pain and paresthesia over the marked structure, over the marked area. Which of the following nerve is involved? Yes, answer this. Students, answer this. Which nerve is this? Any guesses? This is the median nerve. Okay, that's a median nerve. Very good. That's a median nerve. Quickly tell me. Okay, very nice. Fast to answer this. Tell me students, who supplies the skin over the thenar eminence? Chalo, if you can answer this. The skin over the thenar eminence is supplied by palmar cutaneous branch of median nerve. Palmar cutaneous branch of median nerve. Who supplies the skin over here? That's a palmar cutaneous branch of ulnar nerve. Okay, palmar cutaneous branch of median nerve, palmar cutaneous branch of ulnar nerve. This is the palmar aspect and this is the dorsal aspect. Okay, palmar cutaneous and the dorsal cutaneous branch. Yes, Rama, you can watch this. So tell me students, who supplies this 3.5 fingers? 3.5 fingers on the palmar aspect. 3.5 fingers on the palmar aspect is supplied by whom? Median nerve. 1.5 fingers on the palmar aspect is supplied by whom? Students, can you answer this? 1.5 fingers on the palmar aspect is supplied by the superficial branch of ulnar nerve. Superficial branch of ulnar nerve. Okay, so look here, students. The skin over the thenar eminence is supplied by palmar cutaneous branch of median nerve. Skin over the hypothenar eminence is supplied by palmar cutaneous branch of ulnar nerve. 3.5 fingers on the palmar aspect is supplied by median nerve. 1.5 fingers on the palmar aspect is supplied by the superficial branch of ulnar nerve. Superficial branch of ulnar nerve. Now come to the dorsal aspect. Dorsal aspect. Now, 3.5 fingers on the dorsal aspect, 3.5 fingers except the proximal phalanges. This is supplied by whom? Median nerve. 3.5 fingers except the proximal phalanges is supplied by median nerve. 1.5 fingers except the proximal phalanges. This is supplied by superficial branch of ulnar nerve. Superficial branch of ulnar nerve. Now tell me, students, this 2.5 proximal phalanges of 2.5 fingers and the dorsum, ये कौन supply करता है? ये कौन supply करता है? The proximal phalanges of 2.5 fingers and the dorsum is supplied by the superficial branch of radial nerve. Superficial branch of radial nerve. And this what is left, अब जो बाकी है ना 2.5 proximal phalanges of 2.5 fingers and ये जो dorsum है, इसे कौन supply करेगा? इसे supply करता है dorsal cutaneous branch of ulnar nerve. Dorsal cutaneous branch of ulnar nerve. I hope this is clear to all of you, students. Superficial. Okay, look once again. I'll just quickly repeat this. ये मैं repeat कर रहा हूँ. देखिए. Palmar aspect, dorsal aspect. The skin over the thenar eminence. That's a palmar cutaneous branch of median nerve. The skin over the hypothenar eminence. Palmar cutaneous branch of ulnar nerve. 3.5 fingers on the palmar aspect, median nerve. 1.5 fingers on the palmar aspect, the superficial branch of ulnar nerve. Superficial branch of ulnar nerve. Dorsal aspect. 3.5 fingers except the proximal phalanges. 3.5 fingers except the proximal phalanges. That's median nerve. 1.5 fingers except the proximal phalanges. 1.5 fingers except the proximal phalanges. That's the superficial branch of ulnar nerve. Superficial branch of ulnar nerve. The proximal phalanges of 2.5 fingers, lateral. The proximal phalanges of 2.5 and the dorsum, that's the superficial branch of radial nerve. Superficial branch of radial nerve, and the proximal phalanges of 2.5 fingers and the dorsum on the medial aspect is supplied by the dorsal cutaneous branch of ulnar nerve. Clear बच्चों? समझ में आ रही है? Is this clear? Easy? Okay. Fine. We go to the next MCQ. So you'll get a PDF of this session on our Telegram group. Okay, PW Med Ed. So students, this is an attempt by the PW team, just a final revision, a final brushing before your NEET PG exams. I hope you are understanding this, you're following this. In case of doubts, do get back to me. Right? Fine. Answer this. What is this muscle? Identify the pointed structure. Come on, if you can answer this. A video will be there, bacha. Video will be there. What is this pointed structure? Any guesses, students? Any guesses? This pointed structure. Yes, Shifana. Now it's over. Just 2-3 MCQs बाकी है. Palmar interossea नहीं है बच्चा. This is not palmar interossea. What is this? What is this structure? That's the lumbrical. ये है lumbrical. This structure is the lumbrical. This is number 1, this is number 2, this is number 3, and this is number 4. These are the lumbricals. Okay, these are the lumbricals. Now, this lumbrical students, this lumbricals arise from which tendon? ये कौन से tendon से arise होते हैं? The lumbricals arise from the tendons of flexor digitorum profundus. Flexor digitorum profundus. Okay, the lumbricals arise from the tendons of flexor digitorum profundus. Lumbrical sahiye. The intraossei will arise from the bones na bacha. Intraossei will arise from the metacarpal bones. Palmar intraossei, dorsal intraossei. They arise from the metacarpal bones. है ना? तो ये lumbricals है. The first and the second lumbrical. The first and the second का nerve supply is median nerve. Median. Third and fourth lumbrical का nerve supply is ulnar nerve. So first and second, yes, very good. The first and second is median nerve. The third and fourth is supplied by the ulnar nerve. Okay. What is the action of lumbrical, students? These lumbricals are going to cause flexion at metacarpophalangeal joints and extension at interphalangeal joints. Yes, Prince. Yes. Very good. So what is the action of lumbricals? ये lumbricals क्या करेंगे? Flexion of metacarpophalangeal joints and they will cause extension of interphalangeal joints. अगर ये lumbricals paralyze होते हैं, so what happens? You get hyperextension here and hyperflexion here, and this is what we call as a claw hand. इसे हम बोलते हैं claw hand. Okay, so claw hand is due to paralysis of the lumbricals. अगर median nerve injury होता है तो first and second lumbricals would be paralyzed. You get claw hand of the 2 digits, the index finger and the middle finger. If the ulnar nerve is injured, you get claw hand of the ring finger and the little finger. आप इसे बोलोगे partial claw hand. So partial claw hand is due to paralysis of median and ulnar. And if both median and ulnar nerves are damaged, अगर दोनों median and ulnar nerves are damaged, what do you get? You get a complete claw hand. And complete claw hand is due to paralysis, is due to injury to the median and the ulnar nerve, and this is what we get in Klumpke's paralysis. है ना? Klumpke's paralysis में C8 and T1 is involved, and ये जो T1 होता है ना, Klumpke's paralysis में C8 and T1 is involved. Yes, Atib, what are you doing? Just wait, listen to this. Klumpke's paralysis में कौन involved होता है? Klumpke's paralysis में C8 and T1 is involved, and this T1 supplies the small muscles of the hand. Okay, देखो मीडियन नर्व इंजरी होता है तो 2 डिजिट्स का क्लॉ हैंड होगा, अल्नार नर्व इंजरी होता है तो 2 डिजिट्स का क्लॉ हैंड होगा. इसे हम बोलेंगे पार्शियल क्लॉ हैंड. दिस इज व्हाट वी कॉल एज पार्शियल क्लॉ हैंड. एंड इफ बोथ मीडियन एंड अल्नार नर्व्स आर डैमेज्ड, यू गेट अ कंप्लीट क्लॉ हैंड. एंड दिस कंप्लीट क्लॉ हैंड व्हेन डू वी गेट? इन Klumpke's paralysis. Okay, that's injury to the lower trunk of the brachial plexus. C8 and T1 is involved, and ये जो T1 है ना, T1 that supplies the small muscles of the hand. So that leads to complete claw hand. T1 is mainly present in median and ulnar nerves. Wait, Prince, I'll answer your question. Just wait. Let me finish this. Answer this. Prince, just wait. Let me finish this. Number 21. A 60 years old male came to the physician with swelling in the inguinal region. On examination, the inguinal lymph nodes were enlarged. A painless cancerous lesion of which of the following organs can be suspected? Prince, just wait. Let me finish this, then I'll answer. I'll see your question. Answer this. Students, answer this. A 60 years old male came to physician with swelling in the inguinal region. The inguinal lymph nodes were enlarged. A painless cancerous lesion of which of the following is suspected? Answer this. Answer is penis. No, prostate nahi hai. Prostate urinary bladder drains into the internal iliac group of lymph nodes. Testis drains into the para-aortic lymph nodes. This is very important. Our testis and ovary drains into the para-aortic lymph nodes. ठीक है? The penis, I told you, no? अभी मैंने बोला, the penis and the clitoris drains into the superficial inguinal lymph nodes. The penis and the clitoris drains into the superficial inguinal lymph nodes. The glans penis and the glans clitoris drains into the deep inguinal lymph nodes. So inguinal lymph nodes are enlarged. So the answer is penis for this. Penis for this. Clear है सबको? Is this clear to all of you? Testis drains, testis and ovary. ये कहाँ पे drain करता है? Para aortic lymph nodes. The penis and the clitoris drains into the superficial inguinal lymph nodes. The prostate, the bladder, that is how abdominal organs will drain into the internal iliac lymph nodes. Internal iliac lymph nodes. Clear, bachcho? Is this clear to all of you? Okay, coming to the next MCQ. Answer this. A 60 years old lady complains of pain in the left knee joint. MRI scan reveals increased joint space and degeneration of the medial meniscus. One of the following statement about the medial meniscus is true. So medial and lateral meniscus, what are they? These are the fibrocartilage. ये fibrocartilage होता है ना, this is made up of fibrocartilage. Which meniscus is more prone to injury? The medial meniscus. Okay, medial meniscus is more prone to injury. Is more prone to injury because it is firmly attached to the tibial or the medial collateral ligament. It is firmly attached to the tibial collateral ligament, also attached to capsule of the knee joint. Capsule of the knee joint. Okay, so the medial meniscus is firmly attached to the tibial collateral ligament. It is also firmly attached to the capsule of the knee joint. So जब forceful movement होता है ये meniscus rupture हो जाता है. Lateral meniscus is never injured because lateral meniscus is not attached to the capsule of the knee joint. Students, answer. The lateral meniscus is separated from the capsule by, answer this. Lateral meniscus का कभी injury नहीं होता है. Lateral meniscus is never injured because the lateral meniscus is not attached to the capsule of the knee joint. Who separates the lateral meniscus from the capsule? The popliteus. The popliteus separates, yes, very good. The popliteus separates lateral meniscus from the knee capsule of the knee joint. Okay. The popliteus separates the lateral meniscus from the capsule of the knee joint. Clear? Prince, just wait. I told you, just wait, Prince. Let me finish the questions. Now, this meniscus is made up of hyaline cartilage. Wrong. It is made up of fibrocartilage. It is made up of fibrocartilage. Okay, this meniscus is made up of fibrocartilage. Okay, fixed to the medial collateral ligament. Yes. It is O-shaped. Yes. Which of the following is true? It is C-shaped, है ना? C-shaped. One of the following statement about medial meniscus is true. It is firmly attached to the medial collateral ligament. That's clear? Yes. Injury to the lateral meniscus is more common? No. Injury to the medial meniscus is more common than the lateral meniscus. Yes. And medial meniscus is C-shaped. O-shaped lateral meniscus होता है. हाँ, O-shaped lateral meniscus होता है. I hope this is clear to all of you. So who separates the lateral meniscus from the capsule? Popliteus. Okay, chalo, just see this. 23rd. Okay, answer this. A 50 years old lady underwent a surgery for varicose veins. Her calf pain decreased, but she complained of loss of sensations over the medial aspect of the leg and foot. Which of the following nerve is likely to be damaged? If you can answer this. Yes, which of the nerve is likely to be damaged? The answer is saphenous nerve. Saphenous nerve. Look at this. Just wait. Prince, I'll take your question, bacha. Just wait. Tell me this. This is a very important MCQ, students. ये बहुत important MCQ है. That's the foot here. That's the plantar. Sole है. ये sole of the foot है. So tell me, who supplies the skin on the medial aspect of the foot up to the great toe? Who supplies the skin on the medial aspect of the leg and the foot up to the great toe? This is the saphenous nerve. Saphenous nerve. Who supplies the skin on the medial aspect of the great toe? Students, skin on the medial aspect of the great toe is supplied by superficial peroneal nerve. Okay, superficial peroneal nerve. All the web spaces समझते हो ये web spaces of the foot, all the web spaces are supplied by whom? All the web spaces are supplied by superficial peroneal nerve. Superficial peroneal nerve. The first web space, students, where we put our slippers, यहाँ पे slippers लगाते हो, so this first web space is supplied by whom? Deep peroneal nerve. Deep peroneal nerve. Okay, so the first web space is supplied by the deep peroneal nerve. The heel is supplied by whom? Tibial nerve. The heel is supplied by the tibial nerve. Then 3.5 fingers is supplied by medial plantar nerve. 3.5 fingers is supplied by medial plantar nerve, and 1.5 fingers is supplied by lateral plantar nerve. Okay. So this is the soul, soul ka ye nerve supply. Students, this is extremely important. Am I very clear about this? So the medial aspect of the leg and the foot up to the great toe is supplied by saphenous nerve. The medial aspect of the great toe is supplied by the superficial peroneal nerve. All the web spaces are supplied by superficial peroneal, except the first web space is supplied by the deep peroneal nerve. The lateral aspect of the foot, I didn't tell you this, the lateral aspect of the foot is supplied by sural nerve. Sural nerve. The heel is supplied by tibial nerve. 3.5 fingers on the plantar aspect is supplied by the medial plantar nerve, and 1.5 fingers is supplied by lateral plantar nerve. The medial and lateral plantar nerve both are branches of tibial nerve. The medial and lateral plantar nerve both are branches of tibial nerve. Clear to all of you? So answer for this is the saphenous nerve. Saphenous. Chalo, now 1 or 2 MCQ students, can you answer this? What is this slide of? What is this slide of? Histology. Prince, रुको जरा, रुको. Yes, students, what is this slide of? Any guesses? Any guesses? Any guesses? What is the slide of? This is a slide of, see, ये ना, ये मसल का स्लाइड है, मसल, एंड ये न्यूक्लियस कहाँ पे? न्यूक्लियस पेरिफेरी पे है, पेरिफेरी पे न्यूक्लियस है. सो दिस इज अ स्लाइड ऑफ स्केलेटल मसल. स्केलेटल मसल. अगर कार्डियक मसल का स्लाइड है ना, कार्डियक मसल, सो कार्डियक मसल वुड बी शोइंग ब्रांचिंग. ब्रांचिंग होगा कार्डियक मसल में. एंड वेयर इज द न्यूक्लियस इन द कार्डियक मसल? इट्स इन द सेंटर. न्यूक्लियस सेंटर में होता है, ब्रांचिंग होता है, एंड इंटरकैलेटेड डिस्क होता है कार्डियक मसल्स में. कार्डियक मसल, दिस इज अ स्केलेटल मसल. दिस इज अ स्लाइड ऑफ अ मसल. न्यूक्लियस इज एट द पेरिफेरी. न्यूक्लियस पेरिफेरी पे दिखता है, सो दिस इज अ स्केलेटल मसल. अगर ये कार्डियक मसल होता, सो कार्डियक मसल में ना ऐसे ब्रांचेस होते हैं, ब्रांचिंग होते हैं कार्डियक मसल में, एंड द न्यूक्लियस इज प्रेजेंट इन द सेंटर. हाँ, न्यूक्लियस ऐसे सेंटर में होता है कार्डियक मसल में. फाइन. Okay, students, what is this slide? Can anyone guess the slide? Can anyone guess the slide? What is this? Very specific है, ये बहुत specific slide है. ये देखो ये. This is the eyelets. This is the eyelets of Langerhans. Eyelets of Langerhans. And this is the exocrine part. Exocrine part of the pancreas. exocrine part of the pancreas, and that's the islets of Langerhans. So this is a slide of pancreas. The exocrine part of the pancreas resembles a serous salivary gland. Serous salivary gland. मतलब इसमें serous acinus होता है, serous acinus. Okay, so the exocrine part of the pancreas resembles what? A serous salivary gland. उसमें serous acinus होता है, and the endocrine part of the pancreas is the islets of Langerhans. So that's how you identify the slides of the pancreas. And just one last slide for you students. The last slide before we close the session. Come on students, the last slide. If you can answer this, what is the slide of? The last slide of the day. ये देखो, ये ना बड़े 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 सेल्स दिख रहे हैं, ये बड़े बड़े सेल्स दिख रहे हैं, ये कॉन्ड्रोसाइट्स है. ये बड़े बड़े सेल्स जो देख रहे हो आप, दिस आर द chondrocytes, and the chondrocytes are large in size, and this is an elastic cartilage. Elastic cartilage. Okay. So chondrocytes are large in size, बीच में elastic fibers होते हैं. This is a slide of elastic cartilage. अगर ये hyaline cartilage होगा, hyaline, so hyaline cartilage में chondrocytes are in a group. ऐसे groups में होते हैं. Hyaline cartilage में chondrocytes group में होते हैं. इसे हम बोलते हैं cell nest. Cell nest. And the matrix is amorphous. Matrix amorphous होता है. ये hyaline नहीं है. Matrix is amorphous. हाइलिन कार्टिलेज के कॉन्ड्रोसाइट्स आर स्मॉल इन साइज. ये जो बड़े बड़े कॉन्ड्रोसाइट्स है ना, दिस आर वेरी लार्ज कॉन्ड्रोसाइट्स. द लार्जेस्ट साइज ऑफ कॉन्ड्रोसाइट्स आर सीन इन इलास्टिक कार्टिलेज. ये याद रखना, लार्जेस्ट साइज ऑफ कॉन्ड्रोसाइट्स आर सीन इन इलास्टिक कार्टिलेज. दिस हाइलिन कार्टिलेज पेरिकॉन्ड्रियम होता है. कॉन्ड्रोसाइट्स आर इन अ ग्रुप. इसे हम बोलते हैं सेल नेस्ट. सेल नेस्ट. ओके. एग्जांपल्स ऑफ इलास्टिक कार्टिलेज, एपिग्लॉटिस, पिन्ना. एग्जांपल्स ऑफ हाइलिन कार्टिलेज, the trachea, the thyroid, the cricoid. And white fibrocartilage mein what do you have? You have collagen fibers. You have collagen fibers, and you've got chondrocytes. And because of plenty of collagen fibers, the chondrocytes are very small in size, and you get the smallest size of chondrocytes in white fibrocartilage. Smallest size of chondrocytes are seen in white fibrocartilage. Okay, examples of white fibrocartilage is intervertebral disc, pubic symphysis. Okay, I hope things are clear to all of you students, and this is from the PW Med Ed team. Special revision for this batch, appearing for the NEET PG. I hope things are clear to all of you and you have enjoyed the session. If you have any doubts, just get back to me. All this PDF will be available on our Telegram group. All the best to all of you, my dear students. All the best. God bless you. Revise things. Believe in yourself. Put in hard work, and you will definitely succeed. Okay, all the best to all of you. Yes, Prince, bolo. Blood supply of the heart में बोलता हूँ बीच में ना, in between I'll tell you in between. Blood supply of the heart. Oh, left coronary, right coronary. I'll tell. वो एक है ना सेशन मैं बीच में ले लूँगा. You can attend that. Okay, thank you to all of you. Thank you. हाँ गुप्ता बोलो. Prince, what is the doubt that you have? क्या क्वेश्चन है बोलो आपका. बोलो गुप्ता. Prince. Yes, Prince, बोलो बच्चा. Pubic symphysis is an example of white fibrocartilage. Okay, so thank you to all of you. Thank you to all of you. All the best, and God bless you. Ulnar paradox. Ulnar paradox क्या होता है ना? Normally, in high lesions of ulnar nerve, the lesion is more. Normally, high lesions होता है ना, तो lesion is more. Low lesions में lesion is less. In ulnar nerve, it is opposite. High lesions में lesion is less. and low lesions में lesion is more, so that is known as ulnar paradox. Okay, paradox is opposite. ठीक है? Okay, thank you and goodbye to all of you. Goodbye to all of you. Goodbye. Prof के courses will be launched for you. Go through the slides, go through the PDF. अगर कोई doubt है तो get back to me. Okay, thank you to all of you. Thank you. All the best. Thank you. I'll stop.